and we are recording.
Thank you, Dave. Good evening and welcome to the Oshkosh Area School District Board of Education meeting for Wednesday, June 10th, 2020. Has this meeting been properly noticed?
Yes, it has.
Thank you. Would you please call the roll?
Carlin.
Here.
Evans.
Here.
Garner.
Here.
Herzog.
Here.
Olmsted.
Here.
Peschel.
Here.
Szilagyi.
Here.
We have a quorum.
Thank you very much. At this time, I would invite all of you to join me in the Pledge of Allegiance, led by Dr. Cartwright.
I pledge allegiance to the flag of the United States of America
And
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Dr. Cartwright. We have a special presentation tonight, and so I will next turn to Dr. Cartwright for recognition of Catalpa.
Thank you so much. We wanted to take an opportunity. This past year, during our Celebrate Education event, Catalpa Health had received our 2020 Partners in Education Award. And we wanted tonight to give them that recognition since we were unable to do it during the event earlier this school year. So it is an honor to help recognize Catalpa Health as a recipient of the Partners in Education Award. Good mental health is critical to a child's success in school and life. In the Oshkosh Area School District, we are committed to supporting the health and wellness needs of all students, and we are grateful for our partnerships with mental health experts, including those from Catalpa Health. Catalpa Health is an organization that works to help children and families in the Oshkosh community improve their mental health and wellness. Its impact in our district is extensive. Catalpa regularly receives referrals from the Oshkosh Area School District staff for students who need emotional or mental health support. In this way, we are able to connect our students with experts who provide seamless, compassionate care and who are committed to creating a path of wellness for every child in need. Additionally, Catalpa has partnered with our district to help support the mental health needs of students through our Rise Up program, which you will be learning more about tonight. Rise Up is a comprehensive mental health framework that supports the mental health needs of students through education, identification, and direct services. Catalpa currently provides clinical therapy to students in need at 12 of our 20 school sites. This year, the district received additional grant funding to partner with Catalpa to employ a part-time mental health navigator. The purpose of this position is to help students and families overcome any barriers that would otherwise prevent them from accessing mental health services. In addition to supporting the district through Rise Up, Catalpa Health has staff members who participate on the district's Students Wellness Committee. In this way, we are able to work together to support our students and families. The Oshkosh Area School District is fortunate to have an established and quality mental health provider in the community with which to partner. Catalpa Health has proven to be a valuable resource for our families, students, and staff, and the organization deserves to be recognized for their incredible efforts and impact. And if it's okay with you, Dr. Herzog, I would like to invite Mr. Kiemer and anyone from Catalpa that may want to speak just for a moment.
Thank you.
Thank you, Dr. Cartwright. So I have here the plaque for Catalpa Health. It's probably really difficult to see right now, especially with the blazing light right above it. But as soon as I am able to, I will give this to you in person. Catalpa has been an invaluable partner for our school district in not only supporting our students through the Rise Up program, but supporting our community in general. They're just as valuable to the greater Oshkosh community and the Fox Valley community as a whole. So thank you for all you do.
Thank you, Mr. Kemmer. Is there anyone else who wanted to be part of this recognition of Catalpa?
Certainly I will. I'm Mary Downs, and I have the honor of serving as president and CEO of Catalpa Health. And I was involved in the formation of Catalpa back a number of years ago. And it was formed because leaders in our community were really challenging the healthcare systems to provide a better system of care to kiddos. Because we just, no one system was covering the entire basis of what we needed to, and we owed more to the kiddos that we serve. And so Catalpa really formed from a collaboration, and it's really in our DNA. And so we are thrilled to have an opportunity like the one that we do with you to really be partners to making a difference in the lives of children. And so to work with you and to work with Samaritan, because we know there are so many things that are on your plate as a school district and as educators. And there are so many concerns that the children that you serve have. And for us to play any role in that, in lightening your load, making a difference in the lives of the children that you serve is really so important to us. And so we are incredibly honored and touched by this recognition this evening, and we're thrilled to be at your side.
Anyone else? Well, thank you, Dr. Cartwright, for that well crafted introduction and description, and Mr. Kemmer and Mrs. Downs. Mental health is a big concern of all of ours. Especially in this time of pandemic when children have been deprived of the opportunity to interact one-to-one with their friends and to spend time with them as they have in previous years. But even without the pandemic, we know that unless we address social and emotional needs of our students, it's very difficult to ensure success of each student. So we are grateful for your efforts and those of Samaritan and others who contribute to the well-being of our students. Thank you very much. With that, then I'll move on to board and administrative reports, starting with the board president's report. Since we last met at the end of May, I have represented the Oshkosh Area School District with the Wisconsin Association of School Boards. We've had two professional executive meetings, and all virtual. And one of the things that the WASB is looking at is reducing their expenses for the coming year, not knowing exactly what may happen. We also had some conversation regarding the planned joint convention of the Wisconsin Association of School Business Officials, the Wisconsin Association of School District Administrators, and the WASB at the January convention. They are still hoping for a face-to-face convention. And they are also looking ahead to face-to-face meetings in the fall. We have regional meetings typically in the September, October timeframe, but that will depend on what's happening with the pandemic. I also represented this board at a meeting, virtual meeting called the Professional Standards Council. Their role is to recommend changes to the State Department, the Wisconsin Department of Public Instruction leader, Dr. Carolyn Stanford Taylor. This is the group, among others, that have recommended that the FORT, the Foundations of Reading test, not be required of special education majors in teacher education programs as long as they can demonstrate that they have acquired the knowledge and skills to teach reading, including the teaching of phonics. Southwest Rotary's meeting today was special for me on two accounts. Number one, it recognized 4 of our graduating seniors who have received scholarships from Southwest Rotary. John Conrad from Oshkosh North High School, Maggie Koenig from Oshkosh West, Zoe Rusinski, who I believe is also from North, and Regan Krause all received recognition at the virtual meeting. And 2 of them are going into STEM careers. One is going into investment banking, And the fourth one, I think, was international relations. Southwest Rotary also recognized the efforts of all 3 Rotary clubs of Oshkosh for a fundraiser held last week called Chips for Kids. Many of you who had enjoyed dining at Lara's Tortilla Flats and enjoying her tortilla chips and her saucy salsa probably will remember how fond you were of those items. And she resurrected those menus, and over 600 pounds of chips were sold. I forget how many containers of either green salsa provided by South of the Border restaurant and Ada's saucy salsa. The 3 Rotary clubs together raised roughly $5,000, which will be donated to the Oshkosh Area School District's Grab and Go program. And I profoundly thanked the Rotary clubs for this fundraising effort on behalf of our parents and children. Last week was very unique in that we held virtual graduations, I believe probably for the first time ever in this school district. And I want to commend our principals, Mrs. Kiffmeyer at North, Mrs. Cole at West, Dr. Cartwright, and the many staff and parents and students who all contributed to the success of these programs. These were not the graduations we thought we would have when we started the 2019-2020 school year, but I felt they were very well done. And as the late President John Kennedy has said, and I've quoted him before, children are our most valuable resource and our best hope for the future. And when you looked into the eyes of the students graduating, the hope is there, the hope and the dreams moving our district and our community forward. Riverside also held its graduation. This is an alternative high school program, a joint effort between the Oshkosh Area School District and Fox Valley Technical College. Lisa Leader and Rhonda Bricko again did an outstanding job of organizing a first-time virtual graduation, honoring these students and their successes. And finally, I continue to be so awed and overwhelmed by the efforts of our entire district staff, teachers, paraprofessionals, custodial maintenance crews, our food service, our building level administrators, our central office, for the just countless efforts, tireless efforts to ensure that the final 12 weeks of our school year ended as successfully as possible. I visited with some of the e-cook staff on Tuesday in the 90+ degree heat, or I guess that was Monday, whatever day that was. Monday, I guess it was. As they sat outside with their masks on, maintaining social distance, but being there for the students and making sure that we collected the materials we needed and the students got their materials back. So again, I just am so impressed with our staff and the countless efforts and often the thankless efforts that they have provided for our school district and continue to provide. So again, thank you. That's such a small word, but I can tell you it comes from the heart. With that, I will happily move on to the superintendent's report.
Thank you so much, Dr. Herzog. Just a moment while we pull that up for you. So the Oshkosh Area School District transitioned to its annual summer meal distribution program for children only that started on June the 4th. The summer meal program replaces the grab and go meal program that we activated in response to the school building closure during the COVID-19. A lot of this is also due to the fact that at this point in time, there are multiple agencies right now that are able to provide food to the adults within our community. Therefore, the need for the district in order to continue providing that level of service is no longer existing. On the screen, you will see details of our summer program, and this information is also available on the district website. As we move forward, I would like to take a moment to recognize and thank the many individuals and donors that made our free grab and go meal program possible. We were able to serve nearly 145,000 meals to those in need. We're grateful to have been able to serve our community in this way during a time of need. Webster Stanley Middle School's art club members were part of the Global Art Exchange Memory Project. At the start of the second semester, students created artwork with the theme of peace and friendship. Their artwork was sent to students in Syria who shared artwork back in return, of course digitally, but with all of our students during late May. Drew Lasky, a junior at Oshkosh West High School, was recently named Student of the Year by the Leukemia and Lymphoma Society's Wisconsin chapter. Drew received the honor for his efforts, raising over $50,000 to further the organization's goal to find cures for blood cancers and ensure that patients have access to life-saving treatments. Congratulations and great job, Drew. Congratulations to our 11 student interns who recently graduated from the district's one-year Project Search program. Project Search is located inside Ascension Mercy Hospital and is a fully inclusive vocational training program for students aged 18 to 21. Interns in this program complete 3 internships to gain marketable and transferable work skills to find and maintain meaningful, permanent employment within the community. Washington Elementary teachers and staff put together a Storytime collection of books for students to engage with during online learning. Each book is read by staff members from Washington, and with a click of a button, students can hear from their very own Washington staff family. The Washington staff is excited to see it expand and to use it in classrooms next school year as well. Brian from Oshkosh West has been using his 3D printer to create plastic face shields, which he has graciously donated to our district. These face shields will be used by school nurses and other district employees when school resumes. Thank you so much, Brian. 4 students from Oshkosh West were named National Merit Scholarship Program semifinalists. Congratulations and job well done. These students qualified based on their performance on the PSAT and other exams taken in the fall of 2019. The students will be required to meet specific scores on either the ACT or SAT and complete an application in order to advance to the finalist status. Over the last 2 weeks, our schools have been working with families to return and collect student and district belongings. This was an incredible undertaking and certainly not how any of us expected to end the year. However, we are so proud of everyone involved. We're also extremely gracious to our parents and caregivers of our students who participated in coming to drop off and pick up for their patients. And we are incredibly thankful for all of the personnel, as you can see pictured below, that were involved with that in the work that they did to have it completely organized, structured, and flawless as we were able to distribute information, materials, and pick up materials back from our families. Over 175 of our staff members recently participated virtually in a 2-day training from individuals presenting the Integrated Comprehensive System for Equity, otherwise known as ICS, framework in preparation for our ongoing work towards equity. Staff that were trained are those from leadership teams at each school site who provide the training throughout the school year to staff members at their site. The district will continue using the ICS framework for this upcoming year as we continue our dedication to providing equity and having equitable processes and systems. As most of you have heard me say in the past, when we're talking about equity, this is a journey. This is not something where it's going to happen overnight. When we address equity, it is a culture change. It is helping people understand how we got where we are. Why are our systems in place that marginalize certain populations? How do we overcome that? and where do we want to go? So it's also not only having a deeper understanding of oneself, one's privileges, understanding what are microaggressions, understanding what are things that to where we are marginalizing populations and underrepresented groups. But once you have that understanding, we know that once you know better, you do better. So that is the phase where we are right now, is developing that common understanding of what are those systems that do suppress and marginalize. From there, we're already starting to work on envisioning where do we want to be. And once we get to that point, it's equipping our staff to have the right resources, the right understanding in order to proceed going forward. These are culture changes. Culture changes take time, and you want to take that time in order to ensure that people are equipped to be able to go on that journey. We recognize in the Oshkosh Area School District that we are not where we want to be yet, but we are absolutely committed to this, and we will be proceeding forward, and we will make gains coming in the future. There are some people who will say, well, your data is not showing it yet. They are correct, and we absolutely recognize that. Remember, a lot of the data is considered to be what is known as lagging data. In other words, it measures things that have already occurred. With this particular journey that we're on, following this ICS framework, we just completed our first year with all staff across the district, and now we are embarking on our second year. So this is a journey, and we just wanted to highlight to everybody what is happening and where we are right now. We had some great news. We pushed this out this afternoon just to make sure that everybody knows. Effective yesterday, the Winnebago County Health Department gave the Oshkosh Area School District permission to go ahead and allow us to use our outdoor spaces. As I've explained to you before, it's a three-pronged process. We first start with the county health department, then we go to our legal counsel, and then we talk with our liability carrier. So we had the last of the three conversations this morning. And so our playgrounds, our tracks, our nature areas, those things are once again available for community public use. However, while using those areas, please know that organized activities or events, that includes like games, practices, scrimmages, those kind of things, those type of things are not allowed at this time. We are also helping our community understand that if you would like to access our facility, the outside of our facilities, not indoors, but outdoors, please understand that you are doing this at your own risk. There are recommendations that we're asking for everyone to take into consideration. For example, if you're feeling sick, please stay home. Don't come out. Make sure that you're washing your hands before coming to the facility, after coming to the facility. Use hand sanitizer while you're out there. If you're coughing or sneezing, make sure you're doing that into an elbow or some other type of cloth or tissue, so that way it can be properly disposed and we're not accidentally spreading anything that you may or may not know that you have. So there's a lot more information that's available simply by accessing the Learn More here available on this slide. And on your screen, you'll see just a few examples of what has been consuming my time lately. There's been a lot of meetings that continue to happen, of course. And I'm fortunate to be able to not only participate in local conversations, but in county conversations, but even across the Fox Valley region, as well as at the national level. This is very important to keep track of this very fluid situation with the COVID-19 and the pandemic and what it means for all of us, so that as we continue with our plans on what school's going to look like in September, we're able to plan accordingly and progressively. So with that, I will, at this point in time, I know that we do have a district administrator supplemental report. Dr. Herzog, I do want to make a clarification on that report. We did have a typo in that report, and so I just want to make sure that I call that out, that people understand that we do recognize there is a typo in that report. In the financial section, so in section 5, the budget financial impact, where it was talking about the costs, we had a typo on the school year. The actual dollar amount that is listed there is accurate. However, where it says AGR revenue based on, and currently it says 2017-18 allocation, that should have been based on 2018-19 allocation, which is the most recent allocation. So I just wanted to do that clarification. And Dr. Harris, do you mind if I call Dr. Brown just to give a high-level report?
I think that would be great, Dr. Cartwright. Thank you very much.
Thank you. Dr. Brown.
Thank you. Trying off my phone tonight. So yeah, the AGR report, I think the main thing here is that I think we all know that our achievement gap reduction with our schools, we're using either the small class sizes of 18 to 1 or 30 to 2 in a couple of our, or in one of our schools. We are also using tutoring 1-to-1 at Jefferson Elementary. And then, of course, we always have coaching happening in all of our schools. You will note that on this report, the progress is given as what took place as the mid-year progress, because we were not able to do end of the year testing and assessments because you needed to do that face-to-face interaction and monitoring. So you will note that those are all assessments from mid-year. At mid-year, we were on our way to see where we were, and it'll be interesting to take a look this fall to see where our students are at.
Any questions for Dr. Brown? Thank you very much, Dr. Brown. I know this program has been around for many years, probably going back to the days in our district when you were a classroom teacher at Webster Elementary.
Yes.
And I'm sure you contributed to the many plaques and the recognition that Webster received over those many years, as it did last year. And Jefferson has received statewide recognition not only this year, but last year. And I don't remember how far back it goes, but usually there's a celebration in Madison recognizing the outstanding achievement of our AGR schools on a statewide basis. And so for all of the staff and the parents who support this program in those schools, we certainly thank you, and Dr. Brown, your leadership as well. So thank you so much.
Thank you.
Okay, moving on then, we have committee reports from our board members. We inadvertently had not included this as an agenda item on the May 27th meeting, and I know Mrs. Olmsted is most eager to give that report. And so we'll start with her before moving on to Mrs. Szilagyi, who emailed me yesterday, and I believe Mr. Evans also has a report tonight. Mrs. Olmsted.
Thank you, Dr. Herzog. I think mine will be short unless you want me to make it long.
I don't know that it's necessary for you to list every single policy we went through, but I'll leave that up to you. I'm not going to censor you. Thank you.
Thank you. We met on May 11th, and we also met on May 18th, and they were updates from Neola. We've already voted on all of those on May 27th. So you've all read those and went through it. Nobody had questions, so I don't think I need to go through any of them. And then also we met on May 28th, and we did back-to-back 3 weeks because of the updates. May 28th we met and we went through 26 of them, and those are all on tonight's. So everybody's read through those also. So if anybody's got questions about any of them or why we had to make changes, let me know. I can definitely scroll through and find that one. And I've got the stacks of the paperwork right here with me that I can get through it. Otherwise, we did have a meeting this Monday, and this Monday's meeting, we did have 2 policies that we are bringing to the full board for discussion. So those will be coming at the next board meeting. So if you guys have any questions, let me know. Otherwise, we've already voted on two full loadfuls of them. And then tonight, the 26th was from the 28th meeting. So
any questions for Mrs. Olmsted? I want to thank you for your leadership on this committee, as well as that of your fellow board members. There's been a lot of time, energy, and effort that have gone into the revision of these policies. So I thank you all for moving this process along. With that, let's move on to Mrs. Szilagyi for her committee report.
All right, let me pull that up. So the Education Committee met on Thursday, May 7th to discuss a few new standard adoptions and curriculum adoptions. The first one was led by Justin Habel, who's the grade 6 through 12 World Language Department chairs. And the World Language Department adopted some new standards, which include 2 goals: communication and cultural and global competence. And under those 2 goals, there are 5 standards. They are interpretive communication, interpersonal communication, presentational communication, intercultural communication, and global competency and community engagement. So the students will study 18 practices that are aligned to these 5 standards, and they'll advance from novice, intermediate to advanced. The teachers have identified the need to update the standards and unpack the new standards for more thorough understanding. Let's see, they're going to update rubrics to be aligned with the standards, and the resource adoption would be budgeted for in the next curriculum adoption cycle. Currently, the curriculum team has teacher-created materials in lieu of using a book. The next thing that we went through was presented by Renee Schumacher, who's the Arts Core Coordinator. So art standards have not been updated since 2000. So there are 4 standards that were adopted for K through 12 students, and they are create. So students will generate, develop, and refine artistic work. The second one is present. Students will develop, refine, and convey meaning through the production and presentation of artistic work. The third one is respond. Students will critically interpret intent and meaning in order to evaluate artistic work. And the fourth one is to connect. Students will relate their artistic work with prior experience and external context. So the fundamental concepts of art, critiques, critical thinking, and creative expansion. And these are the new standards are modeled after the National Arts Core standards, the creating, responding, connecting, and presenting. The district's goal is to remain on a 7-year updating cycle instead of the 20-year gap that we just had. The dance, visual arts, music, and theater standards are in the works for being updated. And it was noted that the OASD has many educators who participate in the state level standard writing teams. And then the final curriculum adoption that we talked about is actually materials adoption in math. So Ms. Julie Conrad explained that there are either digital licenses that are due, and those come on an 8-year cycle, or new resources are needed based on some changes in the subjects include algebra, geometry, algebra 2, and trigonometry. Ebook licenses are being renewed for another 8 years, and some books need replacement. Additional books are being purchased for the UWO CAP Calculus 1 and 2 classes and Advanced Placement Probability and Statistics. So the total estimated cost was $191,590. The district is putting out rebids to look for better pricing due to current vendors, but we were reminded also that this amount is already part of the budget, and it's on a cyclical basis. So the funds for these materials and licenses are coming from what was already created in the 2020-21 budget. And that is all from our meeting.
All right, thank you, Mrs. Szilagyi, and your co-committee members. Appreciate your efforts. And moving on to Mr. Evans.
Yes, thank you. When I heard Liz's report and she mentioned the art standards, I thought to myself, boy, that sounded interesting. I should have been there until I remembered that I was there. I'm on that committee. So I just got a little mental block. I'm reporting on the legislative committee meetings. There are going to be 2 of them. So this is another 2-for-1 special. The first one was held on Thursday, May 28th. And our first item on the agenda, as always, is the legislative update. I reported that most of the topics of discussion over the past 11 weeks regarding legislation have involved COVID-19. And on the horizon will be an election for the new school state superintendent, which is going to be in April 2021. At the last meeting of legislators, Dr. Cartwright listed a number of items the group discussed regarding COVID and future plans, some of which included budget cuts will need to occur. Looking maybe 10 to 15% of a budget cut. Plans for when there is a spike again. Possible budget repair bill and mental health type services to students. Dr. Cartwright was pleased to announce that the Oshkosh Area School District has been receiving positive feedback from legislators about the frequent communication between us and them. The Oshkosh Area School District communication is 1 or 2 steps ahead of other districts in the state. I talked about boards taking action on COVID. On May 27th, there were 12 schools. Currently, there are 14 schools that have submitted correspondence to legislators in regards to COVID-19. And as you know, in our board packet, we're going to become hopefully number 15 if we agree on what the letter states. Last thing we discussed this week is the start of fall classes. With COVID still being so prevalent, there is no real direction being given from the state on starting the new school year. The executive team and administrative team are making plans for many different scenarios in an effort to be prepared for whatever is going to happen. And then our future minute agendas for that meeting, we decided that because things are changing so fast over the next few months, we decided to schedule weekly meetings for the next month, which is June, this month. So we're meeting every Thursday of June, which our first meeting was June 4th. Again, the legislative update. The House of Representatives recently passed the 3rd round of stimulus entitled the HEROES Act, which will be going to the Senate for approval. Included in this stimulus act is aid for schools. So we're kind of keeping our eye on that to see what happens with the Senate. The DPI released the CARES Act funding information. Oshkosh Area School District would receive approximately $1.8 million, but about 300,000 of that amount will go to private area schools, leaving approximately 1.5 million for the district. The CARES Act money can be used through September 2021 toward technology, food costs, supplies, cleaning equipment used for cleaning, etc. And I briefly talked about this letter, but Dr. Cartwright forwarded to the committee a draft of the letter she created for legislators in regards to actions taken by the district related to the COVID-19 and stay at home. Mentioned that letter, as you read, a variety of methods that staff use to reach out to students and families, such as virtual class sessions, chats, cards, letters, emails to students and parents, providing support and preparing the distribution of packets for K-2 students. Basically what Barbara's saying, our teachers really stepped up and did what they needed to do to keep teaching, keep engaging the students. And our next meeting is going to be tomorrow morning, so we just might keep this Zoom meeting going all night long. Thank you.
Thank you, Mr. Evans, and your dedicated co-committee members who are meeting on a weekly basis, as Mrs. Olmstead's committee members have. We don't usually do that quite on that frequent a basis, but I'm grateful for the many efforts, and we live in an era where we need to step up as our students and our parents and our teachers and other staff members have. All right. Are there any other committee reports that I may have missed? Okay, I don't see anyone jumping in here. Next on the agenda would be the non-agenda related public forum. Even though our meetings have gone virtual since at least the beginning of April, we have provided an opportunity for the public to participate in our virtual meetings by filling out a form prior to 5 o'clock on the day of that particular meeting. Once you do that, Those forms go to Dr. Cartwright, and she will read your statements and share them in that way with the entire board. And just as we do in our face-to-face meetings, those oral presentations are limited to 3 minutes each. This evening, we did not have anyone who chose to send us an indication that they wanted to participate in the non-agenda related public forum. Next item agenda would be the agenda related public forum. Same rules apply. And again, we did not receive any communication for inclusion. With that, we will move on to workshops. We have actually 3 numbered workshops tonight, although workshops 2 and 3 will probably morph and transform into one another because they are very integrally related. But we will start this evening's workshops with a Rise Up overview with Mr. Kimmer and company.
Thank you, Dr. Herzog. And before I share my screen, I just wanted to take a moment to introduce my co-presenters this evening. So when I mention your name, if you wouldn't mind just giving a wave, but from Catalpa Health, we have Ashley Strunk. And Mary Downs has also joined us. So Mary, feel free to jump in at any time. From Samaritan Counseling, we have Amy D. Adario, as well as Kelsey Lohaus from Samaritan Counseling. So with that being said, if I can, I'm going to share my screen here. And for some reason, give me 1 second. Here we go. Sorry about that. So we're here tonight to talk a little bit about our Rise Up program. It's been 3 years since Rise Up was created. And at this point, it's time that we come back and provide the board and the community with an overview of some of the things that we've accomplished over that 3-year period. So we've already done introductions. Just to briefly describe Rise Up. Rise Up is a school-based mental health and wellness collaborative. And the key word in that statement is really collaborative. In thinking about the partnership that we have with Catalpa Health and Samaritan Counseling, it truly is a partnership. It's not the traditional service provider customer relationship that most people would envision. Both Catalpa and Samaritan played an equal part in the creation of Rise Up. And I just wanted to mention, having one community-based mental health provider as a partner would make us the envy of most school districts across the state and the country. Having 2 such partners, I think, really sets us apart. And we're very fortunate to have both quality partners in Catalpa Health and Samaritan Counseling, who really take on invaluable roles within our program. So to start out, I'm just going to provide some initial background in terms of how Rise Up came to be. So prior to Rise Up, the district did have quite a bit related to mental health in place. So it's not like before Rise Up, we didn't do anything to address student mental health needs. What we did have in place, though, was very segmented. So we had many different initiatives kind of operating independently. We still had a relationship with Catalpa Health in the form of our host program and Samaritan Counseling in the form of the wellness screen program. But those, the role of both of those organizations look quite different than it does today with Rise Up. So I think the biggest thing that Rise Up did is it really brought everything together. So for the first time, we really had a common vision around mental health. We had common goals. We had methods for data analysis and progress monitoring that were consistent across the board. All those things are really essential and are really what the basis of this program is. So in addition to bringing those pieces all together, some of the other things that Rise Up really did is it created more efficient and effective delivery of the services that we do have in place. It allowed us to really figure out where we have some gaps or some holes that still needed to be filled. And we've really been working hard to make sure that we do that along the way by adding to the Rise Up program. And then really what it did is it helped people conceptualize what our district does to support student mental health. And that is so important as we look for outside funding, filling out grant applications, really having that comprehensive mental health framework to reflect on is really such a valuable thing for us to have as a district. So speaking of funding, when Rise Up was created, it was done so with the financial contribution of the Oshkosh Community Foundation. The district received the Basic Needs Grant, which is a 3-year grant that provided Rise Up with about $100,000 per year. Now, the unfortunate part of that is we're just completing the final year of that grant cycle. So unfortunately, that financial contribution will no longer be in place next year. But we've been able to pick up other contributions along the way in the forms of grants and state and federal funding. So one of those grants is the Wisconsin Department of Public Instruction School-Based Mental Health Grant. The district first received that last year, so that provided us an additional $75,000 for key parts of our program. But this year, we actually received a 2-year grant for $75,000 per year. So that's done a lot to really offset the costs of the program. For the first time this year, we received a grant from the United Way in the form of $45,000. So that's really going to help offset the loss of part of the loss of the Community Foundation Basic Needs Grant. And then along the way, we received funding for other parts from organizations, including the Oshkosh Area Community Foundation Women's Fund, which has been so generous in providing funding for our girls.
I've just lost audio.
Be just one moment. I believe Mr. Kimmer is having some technical difficulties with his internet.
Oh, can you hear me now?
Yes, but we lost your screen share.
Okay, I did too. Let me try to get that back, sorry.
Thank you.
All right, can you see it?
Yes.
Okay.
And we lost you after your first bullet, sub-bullet on the last bullet.
Okay, so the new mental health connection. Is that where we left off?
The OACF Women's Fund.
Okay. Yeah, so we've had another number of other organizations and providers step up to help support Rise Up. So the Oshkosh Area Community Foundation Women's Fund has provided us resources for our Girls Go Forward program, which is a social emotional program at the middle school level for our girls in that population, as well as financial resources to run our youth mental health first aid trainings for the community. The new mental health connection has also provided funding for Sources of Strength, which is an amazing program at our high schools that I'm going to get into here shortly. And then we've been able to use some of our Title IV-A funds to provide some innovative programming in the form of student assistant program groups, which are groups for students who may be struggling with drug or alcohol dependence or really other social and emotional difficulties. That's also gone toward funding some of the clinical therapy that's provided by Catalpa Health and some of our staff trainings as well. So I'm just going to give a brief overview of our Rise Up program. I know our board is very familiar with Rise Up, but some of you out there in the community who are watching may not be. So Rise Up is really 3 main components. It's education, not only for our students, but for our staff and community. And that's really so important because as people learn more about mental health, they're willing to talk more about mental health. And when people are more willing to talk about mental health, it really destigmatizes the topic. And when there isn't as much stigma around something like mental health, people are much more willing and much more likely to seek out the service and support that they need when they're struggling. The second component is identification. So we want to make sure we're identifying the students who are struggling with mental health, and Samaritan does an amazing job in supporting us with their wellness screen in this area. And then finally, we provide direct mental health services and supports for students in need. And Catalpa Health, we talked at length about how valuable of a partner they've been for us. But I also wanted to mention, we do have full staff of pupil service support staff, which include our school counselors, our school psychologists, school social workers, nurses, behavior interventionists, who do an amazing job of supporting students day in and day out. So we're really lucky to have the individuals who we do have in those roles in our district. So in terms of education, traditionally, how we've educated students around mental health involved two things. The first was our elementary school counselor lessons, where the counselor would come into the classroom every other week and provide a lesson. And the other way for our students in upper grades would be through the health curriculum. There are usually mental health units that go along with that. We really wanted to expand the way that we educate our students around mental health. And we've been able to do that in a number of really neat ways. This past year, we started a pilot for social emotional learning. So 5 of our elementary schools started using a curriculum called Sanford Harmony. That really is a research-based way of supporting students through social emotional development. So that's something we're going to continue to look to expand as we move forward. At the upper grades, as I mentioned, we tend to have a mental health unit in our health classes. One of the units that usually is called Signs of Suicide. And Signs of Suicide is a really nice research-based curriculum that teaches students how to recognize individuals who are in mental distress. And then it also teaches them how to be an advocate, or how to seek out support for themselves if it's needed. So we really wanted to make that something that's done on an annual basis for all of our students in grades 6 through 12. So starting this year and going forward, the full curriculum is going to be provided in 6th grade and in 9th grade, but every other year through the senior year, there are going to be boosters for Signs of Suicide. Another great program that I mentioned earlier called Sources of Strength is in place at both of our high schools. And Sources of Strength, it's billed as a suicide prevention program, but it's so much more than that. It's a student-led program. And what our students do is they develop campaigns around mental health that are really based around the strengths that we all have in our lives. So whether it be family, religion, hobbies that we have, everybody has their own source of strength. So it really takes time to reflect on those things. And we really have a strong network of students. And these aren't just our leadership students. We really want students from all segments of our school population. So it very well could include our leadership students, but it could also include athletes. It could include students who are in band, FFA, students who aren't involved in anything. We really want that wide social network to reach as many students as we can. So that program is in year 3, and we've seen a lot of great things from Sources of Strength. And then we also have some extended partnerships with organizations like Reach Counseling and Christine Ann Domestic Abuse Center that come in and do lessons for our students on things like healthy relationships. So we're very thankful for those partnerships as well. We also provide education for our staff in a number of different ways. So every year, all of our secondary staff receive Question, Persuade, Refer, which again is a suicide prevention program. It teaches our staff how to identify adolescents who may be struggling with mental health, and then it teaches them how to start the conversation with those students, and then where to go for help, how to turn it over to our mental health providers who are in the school. So like I said, that's done on an annual basis for our secondary staff. For our elementary staff, we do that every other year. We've also been dedicating more resources to conscious discipline training, particularly for our elementary staff. And conscious discipline is a preventative way of addressing student behaviors. And it really focuses in on adult behaviors and how adults interact with students and how that really sets the stage for student behavior. So that's something we're going to continue to roll out this next year. And then finally, we do offer youth mental health first aid several times a year to all staff members who are interested. And for this year, as a part of our school safety grant, we have a number of staff members participating in their adolescent mental health training. And then finally, for our community, we have the Youth Mental Health First Aid. It's not only for our staff, anybody who is in the Oshkosh community is welcome to attend. We put the information out, try to get it out there as much as we can. We're actually looking at ways of advertising a bit better, just because our participation has been a bit low. And I often hear from people that they didn't know that we offer these trainings, so we really want to make that known. It is an 8-hour training, so you do have to dedicate a good chunk of time, but it is really, really a valuable training where even if you have some background on mental health, it's a great refresher. And even someone like myself who has a background as a school psychologist, there are pieces that I pick up on that I didn't know each time I take it. So if anybody's interested, please reach out. We do have a training coming up, I believe, in August or September. I'll have to get the dates, but I believe we do have some spots left in that class as well if we're able to run. And then finally, we do offer Love and Logic to parents on an annual basis as well. We have 2 Love and Logic trainers in our district who do an amazing job with that training, which does a lot in terms of teaching parents techniques for interacting with their children in a pro-social way. So it's great training. Moving on, identification again. This is where Samaritan Counseling has really been a key partner for us. So I am going to turn it over to Kelsey and Amy at this point to talk a little bit more about their role in Rise Up.
Thanks, Matt. I guess I'll get us started, and then Kelsey, you can talk maybe a little bit more about our outcomes. To just help understand the Wellness Screen program, what we do is we do offer an online screening to students 8th through 12th grade. We are focusing on overall mental wellness, so we really do want to look at all aspects of mental health for students in the Oshkosh Area School District. We are primarily looking at things like depression, anxiety, substance use. We also ask students about self-harm as well as suicidal ideation. What really sets our program apart, I think, from others is that when we do identify potential concerns with a student, we do have them meet with a clinician individually in a private space to talk more about the screen and understand more about that student and their concerns. That helps us to make sure that that student is not an imminent risk, and also helps us to think about next steps and recommendations and ways we might be able to support that student and family. After we have identified a potential concern, met with that student to learn more about them, we reach out to parents individually to then talk about those results and those recommendations. And then we continue to work with that family up to 90 days to really help support them in connecting their student to whatever services might be most appropriate. We do also encourage students that are already involved in mental health care to participate in the screen. That really does help them to keep track of their mental health goals, helps us to look annually at any concerns and any progress toward those goals. So that's really the way we do our program. In the past, we have used, we use 2 different models. In the past, we primarily used an active consent model. And really what that meant was that we were actively seeking consent from parents and needed to receive that consent prior to screening any student. Several years ago, we did move to a passive consent model. So now we anticipate universal screening of all students. We expect that we will screen all students from 8th through 12th grade. But we do offer an opportunity for parents to opt their child out of the program if they choose to. So we do offer a written notification as well as an opportunity to opt the student out. We do provide 2 other electronic notifications so that parents are able to have their student not participate if they choose to. In addition, when students are screened in their classroom, they are asked to assent to the participation in the screen. If they choose not to take that, then we do connect with families to let them know of their student's choice. And then we do stay connected to that family if they would like to have their student screened. So that's really the model that we're using right now with all of the students in the Oshkosh Area School District. As all of you know, many things changed about mid-March of this year, so I'll just share a little bit about the changes to our program. So typically we are in schools, we are in classrooms, and that's really where we see our students. However, with schools not being in session, or at least not in the same building, we had to really rethink our model very quickly. So we did transition to a model that we have used mostly with elementary age students in our program. So what we did was any remaining students, which for the Oshkosh Area School District was mostly our freshmen, we did offer the ability to participate in the screen by giving the online screening link to all parents. So we did ask that parents would participate in this process, and then we would be able to follow up with that family. Unfortunately, we have very few parents that did participate in this model. We have a lot of ideas as to why. It was a pretty overwhelming time for many people, but we did have that available for everyone. Because it wasn't as successful as we wanted it to be, we are looking at alternative options for the next school year because we want to remain available for all of our youth and families. So we really are thinking about really 3 options for moving forward in the next school year based on what we find out. So we are planning for if students and staff, including ourselves, are in the building, how to be really thoughtful and mindful about being involved within school buildings. Also thinking about if students are in the buildings but we aren't able to be, how could we still provide the youth screening as well as our follow-up interviews and then connection with parents. And then we're really thinking about if nobody is in the building again, how could we provide the care that we want to our students. So we are really thinking of using our online platform for the screen itself. We have put in place some telehealth options so that we are able to actually speak to our students to do those follow-up interviews. And then also to be able to speak to parents and then help again, really provide that case management moving forward so that we can offer any support that families might need to get connected to mental health services. I'll turn it over to Kelsey so that she can talk a little bit about our last few years and really thinking about our data.
All right, thanks, Amy. So it's exciting. You can I added kind of our basic numbers on there. The 2017-18 school year, we offered to 2,587 students. And out of those students, 55% participated in the screener and 40% did screen positive, which means they came up on our screener as having some kind of emotional health concern that we wanted to check in with. 2018-2019 school year, we were able to expand to the 8th graders. So that was really exciting. It was fun to get into the middle schools and check in with those students as well. So we offered it to a lot more students that year. Our participation rate did go up and our positive rate dropped. So that's great that we're getting those students connected, hopefully from year to year. And then this school year, the screening was offered to 2,464 students, and that is not including the students that we sent the link online to after schools were closed. So that's why that number looks a little bit lower. Again, the 57% participation rate and the 35% positive rate. So those are still moving in the same direction. Hopefully, as our program continues to grow in the schools and parents get to know us, we hope that participation rate continues to increase and we can help get students connected from year to year, and we'll be with the 8th graders going forward. So it's all good. Anybody have questions about that data?
I did want to mention one thing. Prior to 2017 to 2018, when we had our active consent model, our participation rate was under 20%. So by moving to a passive consent model that we have with Rise Up, we're able to really boost that participation rate. And as Kelsey mentioned, it's still not where we want to be, but our goal is to continue to move that rate up. All right, well, thank you, Kelsey and Amy. Next up is direct services. And again, this is where Catalpa Health has been a huge asset for our district. So Ashley, are you going to take it from here?
All right, thanks, Matt. So Catalpa Health is providing direct service to families or students at the Rise Up program. And really what we're doing is we're putting licensed providers within the schools to provide that direct clinical care. We have every site, the high schools, 5 middle schools, Carl Traeger, Jefferson, Merrill, Reed, and Washington elementaries, all licensed as clinics, essentially, where we're able to see students and bill them for clinical services through the state of Wisconsin. We this year obviously had to transition to virtual environment. And when we transitioned to our virtual environment, we worked on providing telehealth services in which our clinical providers that students were seeing on site were able to reach them in their homes through the telehealth platform. We did have about 23% of clients that engaged in that telehealth service. We did hear from many families that either symptoms were reduced with not having the same level of stressors. We also had families indicate that it was just too difficult for them to engage at this time due to working from home, providing homeschooling or schooling virtually as well with multiple children. We do connect with those families. Many of those families have identified that they would like to at least have touch bases with those therapists, and those therapists those clients are not included in that 23%. However, we have been able to reach more families than that just to make sure that they have the support that they need and that that's available should they choose in the future. And that will continue throughout the summer for those families as well. As far as clinical therapy outcomes, we do an ACORN score. And ACORN is a data analysis that we utilize a questionnaire that really looks at symptom reduction. And one of the measures that we have used within the Rise Up program is really looking at how many students themselves report that their mental health symptoms have decreased. So this school year had 79% of the clients that we see report that they've had a reduce in their mental health symptoms since the start of treatment. The average, or what they like to see, is about 60%. So we certainly are excelling in that area and something that we really strive for with our families. As far as this school year, we were able to provide 177 students care within the Rise Up program, and we've conducted 1,753 visits. And over the course of the Rise Up program, we've provided outpatient therapy for 322 students. Now through that, each year we've seen a significant increase in the number of students we've been able to serve. We've also had some students that have been with us for those 3 years due to chronic mental illness. This year, we also had the opportunity to add a mental health navigator. And the mental health navigator's role is really somebody to help connect families to services or help eliminate barriers. This year, our main focus was how do we get families in the door for those services? We did some research and that from the referrals that we got from the district and families that started services, we only had about 50% of those families who were able to get connected with services. After just a year of that navigator service, we are at 64% of those families who are referred are now being connected to therapists. Any questions about direct service or what we're doing or the outcomes we've had?
All right, thank you, Ashley. So as you've heard, both Catalpa and Samaritan have indicators that they track closely. We meet up on a monthly basis to review that data. But one key piece of data that we always keep a close eye on as well is our youth risk behavior survey. So the youth risk behavior survey is something that's conducted every other year for all of our students in grades 6 through 12. It's a completely anonymous survey. It's actually done across the country, but it really looks at, asks students questions that focus on risky behaviors or health behaviors. So mental health is included as one of the things on that survey. So we've really tracked two indicators all along. The first indicator that we've looked at is one of the questions that says, during the past 12 months, did you ever feel so sad or hopeless for 2 or more weeks in a row that you stopped doing usual activities? So that really factors into depression and anxiety for a lot of our students. The other question that we really paid close attention to is, during the past 12 months, how many times did you actually attempt suicide? When we were first looking to start Rise Up, both of these questions, the results that we were seeing were very, very alarming for us as a school district for two key reasons. If you look at the blue line on this graph, this tracks the student responses for the sad and hopeless question. And as you can see, starting in 2012, we had an increasing trend every time the YRBS was administered in this area. While that really coincides with a national trend where we're seeing increases in depression and anxiety, that's a trend that we wanted to break in the Oshkosh area school district. If you see the vertical blue line right here, this is when Rise Up began. So, I mean, we may not be able to attribute all of this to Rise Up, but you know, when we focus more on mental health, we start to see the changes that we want. And we were able to break that trend. And while that indicator is holding relatively steady, like I said, at the national level, we continue to see a rather steep increase in depression and anxiety for adolescents. So we're hoping that we can at least keep this indicator steady, if not continue to, or find a way to start to decrease that going forward. The other indicator is even more telling for me. So if you look at this orange line here, this tracks the students who responded that they've had at least one suicide attempt in the past year. And again, going back to 2012, you see that we were on the verge of hitting the 15% mark. The state and national averages for this are right around 7.5%. So for quite a while, we were nearly twice the state and national average in this indicator. Our goal for Rise Up when we first started this program was to get that around 6% by the end of year 3, which we thought was a very lofty goal. But you know, as you can see from the graph here, we've been able to cut that dramatically to where the last time we took the YRBS, which was in spring of 2019, we were just above 6% in that indicator. So it's still too high in my opinion, and we know we still have a lot of work to do with regard to student mental health. But I think the trends that we're seeing with our YRBS data, as well as the data that Ashley and Kelsey touched on, show that we're really headed in the right direction when it comes to student mental health. And this is everything I just said. So with that being said, are there any questions?
Hi, Matt. It's Allison. I don't know if, can you tell that it doesn't matter if you can see me. Can you hear me?
I can hear you, yes.
Okay, great. There we go. For the reporting for the last slide for the chart, you're using the YRBS data?
Yes.
And I assume that that's self-reporting?
Yes.
Okay. Is that the same? You were comparing Oshkosh to national trends as well. Are the national trends that you're comparing that data to also self-reporting?
Yes. Yes. Now, the YRBS can look a little bit different from district to district across the country. Wisconsin's taken the step to really standardize it for our state. However, the questions on suicide attempts and the question that focuses in on sad or hopelessness, the questions are phrased fairly similarly across the board. It's just when you look at other states, they may include other questions in their battery in addition to those.
Are there any other metrics other than self-reporting?
So in addition to the data that we looked at with both Catalpa and Samaritan. There are a number of other indicators that we have looked at. So we did do a mental health literacy survey. That's something that went out to our students and staff all 3 years. There's really a lot of information there, and I'd be happy to share more of that with you in person. I didn't include any in the slides just because there was so much of it, and there wasn't anything that really stood out as being overly significant one way or another. The understanding of mental health that we saw early on, particularly for some of our community members, remained fairly consistent over the course of the 3 years, which is why we'd really like to get more people engaged with our youth mental health first aid training and some of the other offerings like QPR that are available in the community. Other indicators that we look at, I mean, we're always looking at attendance, behavior, those types of things. And certainly mental health factors into those things, along with a number of other initiatives that we have in the district. As a part of our social emotional learning curriculum, we actually did something called the SABRS as well for our elementary students. And that's a rating scale that's done by our teachers rating their students. And there's another component called My Sabers for our upper elementary students, where they can rate their own social emotional development. So we've looked at that as well.
Okay. Yeah, I wanted to have a better understanding of what data are we going to look at, and how consistent and how accurate, how close are we to reality? If we're just looking at the self-reporting of teens and adolescents for their own mental health, if that's the only metric that we're using, I worry that it's too small of a data set, and I worry that it isn't as accurate as we would like it to be. So that was my only concern.
Allison, I think, Ms. Gardner, I apologize. I believe that's also where the training comes in order for our adults to recognize signs of students who may be struggling,
Sure.
especially from that suicide component. The self-report, that metric, as Mr. Kamer was reporting, it is, albeit the wording of the question is slightly different from state to state. It does get to the crux of the issue, and it does get to, have you attempted to do this or not? So it's pretty straightforward on that. But again, that self-report, and the beautiful thing of it is it's also confidential, so we can't trace it. I believe that's correct, Mr. Kamer. Is that correct? No, it's not. Hold on.
Yeah,
Mr.
it's completely anonymous.
Thank you.
Well, the understanding, Matthew, is that when kids take this test, if they report yes on certain answers, they're going to get called down and they're going to have to meet with a counselor.
That is for the Youth Risk Behavior Survey. That's not the case. For our wellness screen through Samaritan Counseling.
So the screen is you will get called down for the risk behavior. It's anonymous.
That's correct. And that's
okay, so that boosts the reality or the accuracy of those scores.
Yeah. And one other factor too, when we're talking about mental health needs, there are two different types. We have students who are more externalizing in nature, where when they're struggling with their mental health, we know it as a staff. Everybody really knows it. They tend to demonstrate those behaviors very, very openly and outwardly. We also have a lot of students that are internalizing in nature. And those are the students that we really have a difficult time identifying. And that's where the wellness screen is so important and so impactful. And really it's difficult to assess mental health for internalizers without having them self-report.
Yeah.
As a school psychologist, doing behavioral screenings, really the parent surveys, the student surveys, the adult surveys, using the data from those to triangulate really is one of the only ways that we're able to identify internalizers. So, but we're always open to other ideas and suggestions in terms of data we could look at as well.
Okay.
Mrs. Carlin? Mrs. Carlin?
Hi, yeah, Matt, I just wanted to say congratulations and thank you for all that you guys have done. Seeing that dip is amazing. And I'm really proud of the way our district is addressing mental health. And I think, with the pandemic, it's going to even take a bigger role. And I think that you guys are doing a fantastic job. So kudos to you and your team.
Thank you.
Are there other questions or comments?
Yeah, Matt, this is Jim Evans. As Stephanie mentioned, that graph was quite impressive, and you can tell where the rise is and the numbers start coming down. But do you have any explanation for why it seemed like it started in 2016 before rise? There's something that happened or that we did, or?
Well, the data points are every other year. So it's really difficult to say exactly when it started within that downward trend. And again, with those dips, I'd like to say Rise Up is a major contributing factor. We're doing a lot of other great things in our school district that could also have contributed to that decrease that we've seen with those two indicators as well. But I don't think it's a coincidence that with the creation and the start of Rise Up is really when we started to see a major difference in some of those key indicators.
Any other comments or questions? I think I share some of Mrs. Garner's concerns about self-reporting, although if those are anonymous, I would think they would tend to be more accurate. Prior to coming to the Oshkosh district as an administrator, I served in a school district of about, with a junior high of about 1,300 students. And we met regularly as what we call the care team, assistant principals, counselors, psychologists, and teachers. And the staff were trained to look for concerning behaviors, a major change in a child's demeanor or behavior, dropping grades, disinterest in things, maybe some aggression. And we made a real effort to try to figure out what was going on in each of those situations. I'm sure we weren't 100% successful, but we did make an attempt to try to figure out what was going on. And in many cases, it might have been something like a divorce that a student didn't see coming, or it might have been an abuse issue going on. And so in addition to the self-reporting, teachers who have relationships, staff members in schools who have relationships with children can often pick up on behaviors that are concerning and can be addressed. And that could be any staff member. It might be a teacher, it might be a custodian, paraprofessional. But those are some ways that in addition to surveys, we can focus in on students who may be needing some assistance with social and emotional issues, as well as abuse issues and other causes. Any other questions or comments? Mrs. Olmsted.
Allison kind of touched a point on this, and this is something I've brought up before, and I'm just wondering if we've made any leeway or we've discussed it at all. My concern is when we do these screenings with Samaritan, they're great. Of course, they're a good idea. But as Allison had mentioned, and I know I've heard this from other students and my own kids and their friends, that when they take this test, some of them aren't being honest because they don't want to be called down to the office at school. That they are, that children that you would think would have been pulled on that are not being pulled on that. Mainly because they don't want to be pulled out of office or pulled down to the office or the counselor's office, and then everybody knows why they're going because it was just right after the testing. So is there anything that we could do in the schools that would maybe keep that a little bit more privacy or a little bit less noticeable? That was part one. Part two would be, you guys had said something about that. If we flag a student, they go and they talk to a clinician at the school, which is part of part one. But that part, do they talk to a clinician at school before the parents are because the way that it was just explained tonight was that they go and they take the test and then the screening, and then they're told, you know, they get flagged, and then they talk to a clinician at the school, and then they go talk to the parents. I want to make sure that the parents know that, or how does that work? Do parents know before they go talk to a clinician and tell them things and talk to them? Do parents have to give permission for that also?
Yes, so good questions. So what we do is we do try to wait for the class period in which we screened to end before we call any students down, so that hopefully students have moved on to another classroom. We can't always prevent that a student may not be in a class with somebody they just screened with, but we do try to wait so that we can make it as anonymous as possible for students to be called down to meet with us.
So Amy,
yeah.
It's the same day. They're taking the screener test and then they're being called down to the office the same day?
Correct. So we do meet with them.
Then that's the problem. For me, that's this is just a personal thing. For me, I think then that's the problem. You're doing the screening and then the exact same day you're calling people down to the office. Everybody's going to know. I am hearing back from a couple years of, I've got 3 kids in the district. I'm getting feedback for years that, oh, Mom, people don't do anything on those because they get called down that day and then everybody knows. People don't do that. And I've heard friends say the same thing.
Sure. So what we know from research is that overall students are very good reporters, and so are parents. Okay. Of course, there are students that either don't take the screen seriously or do have the concerns that you have identified. We do have a place on the screen for students to just click a box to speak to us if they'd like to, so they don't even have to answer any of the questions. If they'd like to meet with us, they can. So again, we do try as much as we can to not have them called out of the same classroom they were in. But from our perspective, what we'd like to do is that we are asking them some very personal questions about their mental health. And so we do want to check in with them. We do want to identify any students that might be an imminent risk, and we do that, so that if we do identify any students that may have a concern right now, this moment, we can help support them, or maybe at very high risk. We do meet with them prior to talking to their parents, because really what we want to do is best understand everything about that screen. So we want to make sure they understood the questions. We want to clarify any of their answers they may have had. We want to talk about their time frame, because we ask them questions about short time frames as well as their lifetime. So we do ask them questions about that. And they do. You would be surprised how much students do talk to us about some of the things that you were just describing: divorces, relationship concerns, bullying. Even though we're strangers to them, a lot of times that is very comforting for students. Absolutely. To have somebody who is outside of their school district, outside of their family. And a lot of what we're able to do for students, I think, is bridge a gap for very uncomfortable conversations sometimes with their families. They're not sure how to talk to their parents about some of the things that are concerning to them, especially those internalizers, which are the ones we're really, really trying to target. You guys are excellent at identifying students with behavioral concerns and creating plans and supports. It's those students that aren't talking or sharing and are afraid to talk about those things that we really want to help support and identify. As far as your question around parents, we do notify parents 3 times. We notify parents in writing as well as 2 times electronically. Not just to opt their student out, but also to help explain the program so that they understand that we will be meeting with their students and that we will connect to them. So we really try in our time frame within 24 hours to meet with that student and connect with that parent. So really by the end of that school day, we want to be meeting with that student to make sure that they're all right. And then we want to be talking to that family about those results and our recommendations and supports we might be able to provide them. So we always know that there are concerns from students about being called out of class. I really think that what you all are doing over these years around building a culture of mental health, making this normal, making this acceptable is really the great work, and is really what you're seeing in a lot of those results. Is really trying to make this okay, that this is really what we want to be talking about, this is what we need to be talking about, and that you as a school district have really dedicated time and energy to making sure this is a safe place for students, and that will take time. What I can't wait to see is that because we do screen annually in your school district, is that this will hopefully become more and more normal for kids, hopefully. So we hear this across districts. Kids are afraid of being called down or singled out. And so we really do try to work hard for that, but we're not always able to do that. So know that that is something we are consciously always thinking about, and any suggestions that you have for us to make that better for students, we absolutely want to do.
Okay, some follow-ups then. So how many, so you're there, so you're saying that you give this screening, and then that we want to talk to them that day because we're worried about them that day. How many days are you there screening? Out of the 8 months that they're at school, how many days are people being screened?
Yep, so that really is dependent upon the school availability. So we're usually there 1 to 2 days in the high schools, and then we're there 1 to 2 days in the elementary, or the middle schools.
Okay, so my question is then if we're there, so we're at the high school, right? And there's 8 months of class. If I'm wrong, is it 9 months, 8 months? So we're there 8 to 9 months, and we're screening the kids for 2 days. And we need to talk to them in those 2 days because we don't know where they're at. They just told us that they're in a bad place, so we're going to talk to them. So for my mind, I have a hard time wrapping my head around that. The other 8 months, they're fine. We go in, we screen them for 2 days, and we have to talk to them those 2 days. So I don't know that that is a good way to excuse the fact that these kids are not comfortable being screened and then being pulled into the office the same day. We could wait 4 days. We could wait 2 days. We could, if the screening is really bad, call them down immediately. Obviously, that's the important thing to do. I worry about the people we're missing. My whole point of this is we're missing. If you look at that screen of how many people were actually participating in 3 years, that number hasn't jumped much. It's 54%, 57%. If we don't have these kids come down the same day, I think our numbers would get better. I think our numbers would jump up. I think we get more kids to take this test. I think we would get more participation. We'd get more kids. By no means, I hope this isn't coming off that I don't agree with it. I love this. I was all for, changing the screening to that they have to opt out. That was a big, I'm so glad we did that. I want this. This is so important. The numbers are great. I love Rise Up. I love Catalpa Samaritan. By no means do I want that to come off that this is not a good thing. This is a great thing. I worry about the 40% that we're not hitting, because I think a lot of those are ones that don't want to come down and talk. Those are the ones that are hiding. Those are the ones that probably maybe need it. Yes, some of them are going to blow it off and they're like, they don't need it. But the ones that are going to blow it off are the ones that probably need help, maybe because they're too afraid to come down and they're too embarrassed. And then maybe the ones that are just telling their parents to opt out are the ones that don't want to talk either, and they don't want to be called down. So I'm just hoping that we can try to work something out. And I would not be surprised if we somehow moved this with the testing and talking to the kids. I would think that those numbers would even go up more, but we would get more kids coming to talk to us. Does that make sense?
Yeah, but also,
solution. I'm telling a problem without a solution. So I apologize tremendously. I just want to throw that out there that I really do worry about that 37% or the 32% or the 45% that are not taking that test seriously because they don't want to be called and they're so scared because they don't know, because they don't have that,
Can I clarify one thing?
We have Mrs. Carlin waiting in the wing, so let's.
Matt can go. It's fine.
Please.
I just wanted to point out that when Amy said that we screen for 2 days, she meant 2 days a week. So
right.
West High School almost the entire year.
That makes a huge difference.
Yes.
Yeah. And one more point to screening to calling students down the same day. I understand what you're saying, Kelly. And
okay.
You mentioned we've talked about that, and we try to be as discreet as possible, but there really is no way around not addressing it that day. I mean, if God forbid something would happen to a student that evening, trying to explain to a parent why we had this information and we didn't do anything with it that day,
we didn't act on it.
It'd be a really hard conversation to have.
Okay, thanks, Matt. Those were
a week is a huge difference. And I thought like 2 days a year, I'm like, this doesn't make sense.
No. We do small groups. We do small groups, and we're in the buildings 1 to 2 days per week, depending on the calendar. And we are there from beginning of the year to the very end. So we are there all year. So yes, that is one clarification. Thank you, Matt. And so, yeah, the other thing is that the screening does not give us diagnostic, materials. And so really we cannot always tell from just the screen who may be an imminent risk or not. So the tools give us really an indicator of potential mental health concerns. And then those follow-up interviews really are where we can clarify where students are at and how they answered those questions. And so we do triage all students. So we work together, clinicians and case managers, to really make sure we identify students that look like they may be at the most risk. But what we are doing is really meeting with them to make sure, because they may not fully understand, they may not fully answer everything, as they should have. And so we really want to make sure of that, which is why we really try to have that quick turnaround of 24 hours of meeting with that student and the parent. So when we are meeting with that parent by phone, we're sharing the results, but we're also asking them, what have you seen? Are you concerned? What is happening? We're clarifying if they're connected to providers, all of those kind of things as well. So then that way we also have that double check to make sure that maybe if a student didn't tell us all the information, hopefully we're getting that all from the family. And then from there, we're really able to make those recommendations and help support them for that next several months to get them where they need to go. So yes, sorry for the misunderstanding. That is why.
I was like, when you said once or twice, 1 or 2 times, and I was like, oh, well, this doesn't make any sense. So I was like,
we're there from first full week till into May.
Got it. That makes a huge difference. Okay. Then I understand, Matt, where there is no other way. If you're there that often and doing the testing that often, that makes so much more sense. It still doesn't fix the fact that some students just won't take it and won't go. But that makes, I got it. Okay. I'm good. Thank you so much, Amy. Thanks for your patience.
Absolutely.
Because I was not on the same page.
All right. We've had Mrs. Carlin waiting for well over 5 minutes. And so I'd like to move on to her. And then
that was a great discussion. I'm happy we had it.
It truly was.
I just wanted to pick up on something that Amy said, because we're talking a lot about students who don't want to take it because they don't want to be called out. A lot of the stories that I'm hearing are students that have been longing to talk to somebody about things and don't know how to get help. And these are the students that the parents are so surprised that they have issues too. So I feel like, and Amy kind of went through some of this stuff too. It's a safe space. So I know we worry that some of them might not want to be doing it, but there are a lot of kids too that welcome it because they've been looking for help and they've been struggling, and this is a safe way to get help. So
thank you, Steph. Thank you, because that's not some of the stuff that I've heard. So that's good to know that it's that too. Good.
Did you have anything else, Mrs. Carlin?
Oh no, that's it. That's it. I'm good.
Thank you.
Thank you.
Thank you. Dr. Cartwright.
I think I'm good. I just wanted to emphasize again, one of the points that Mr. Kamer had put up is only because unfortunately I have witnessed it more often than I would like, where a district has done some type of screening, had information, and then something happens later that day, and parents asking, why you knew about this, why didn't you tell us? So the urgency of trying to get things done that very same day, and the urgency in order to do that is one of the critical elements of doing this type of screening and program. And there are instances where you may not be able to get to the student the same day. Maybe they checked out or something to that effect, but you make every attempt to try to follow it up right away, especially if they, again, it's not diagnostic, but if they're really showing some strong indications of potential problematic concerns.
Yeah, I agree. I completely misunderstood. I'm kind of disappointed in myself that I never realized that this went on all year. I really thought that we went in and we tested them for like 3 days and then we moved on to the next grade. I did not know that it was a continuous thing. Hence why I was so confused, like really out of 2 days, we're just going to say, oh, they're just sick 2 days. Like that's why for me, I wasn't grasping it. I I dropped the ball, and I did not know that it was a weekly thing that you guys, I didn't know that. So that makes a big difference. So thank you. Thanks for explaining it.
Thank you for your questions.
You're welcome. Is there anyone else who had any questions or comments? This is obviously a very important area. As I stated earlier, if we don't address the social and emotional issues that impact our students, it's very difficult for them to succeed in the classroom and out of the classroom. And so we do need to address these issues. So thank you to Mr. Kemmer and the team you lead within the district, and with our collaborators, namely those representatives from Catalpa and Samaritan who have joined us tonight, and those who perhaps weren't able to join us but are also participants. All right, seeing no other hands up at this time to participate, we do have 2 other workshop items this evening. And so we thank our presenters on the Rise Up program, and we will move on to workshop item number 2, facilities planning with Dr. Gundlach, Mrs. Schnorr, and a Bray representative, namely Cliff Sell. The financial update is the 3rd workshop, financial update, financial implications for an operational referendum and capital referendum with Mrs. Schnorr and PMA. And those 2 are probably going to overlap, that is. If you think of, as I often look at life as a series of Venn diagrams, there are elements that will be in workshop number 2 only, some in workshop number 3 only, and some that will overlap. And so I anticipate a very lively and fluid conversation on these 2 topics.
We appreciate it. Dr. Herzog, if it's okay, if I may clarify, what we're looking to do is kind of set the plate in order to help people understand where we are currently as far as like our debt analysis, and then lead into talking about our facilities planning, and then going back into where the implications of some of those of the facilities planning. So if it's okay with you, without further ado, I would like to invite Michelle from PMA as well as Ms. Schnorr in order to provide for us a financial update.
That would be fine. So essentially we're starting with number 3.
Just the financial update portion of that.
Okay.
And we're going to transition over into facilities planning with Dr. Gundlach, Ms. Schnorr, Clint Sell, as well as a few of our principals. And then Dr. Gundlach will continue to then transition to talk a little bit about operational referendum, capital referendum, and then we'll pass it back to Ms. Schnorr and Michelle from PMA in order to finalize it.
All right, is the rest of the board okay with that? Since we have a slight deviation from our printed agenda, is the rest of the board okay with that? Appears that is the case. I'm seeing some thumbs up here. All right, let's roll.
And I greatly appreciate it, Dr. Herzog. Fortunately, it all has been publicly noticed.
Correct.
Thank you.
Thank
Ms.
you.
Schnorr, Michelle.
Okay, we have PMA is the district's financial advisor and has been for many years. They advise us on mostly on our debt, both long-term and short-term debt, and debt forecasts. So we have Michelle here to talk a little bit about where our district stands and how we compare to others. So I'll turn it over to Michelle.
Great, thank you so much. Good evening, everyone. I'm going to share with you a presentation. Testing my skills here. Does everyone see that?
Yes.
Perfect. We're calling this a referendum financing overview, but as Dr. Cartwright said, what we're trying to do is just give the board some sort of basis of financial information as you start to think about a potential referendum, both operating and facilities, just to, as she said, set the table in understanding some of the financial metrics of the district. So with that, we'll start with some specific Oshkosh data and trends. Looking first at Moody's Investors Service, this is the credit rating agency that rates the district. And this is these are the metrics that they look at when they are evaluating you and looking at you from a credit rating perspective. And they weight the economy and tax base as 30% of your rating, your finances as 30% of your rating, management as 20%, and debt and pensions as 20%. So they're looking at the strength and diversity of your tax base. They're looking at your finances, including fund balance and cash balance, as well as the trend in those over a 5-year period. They're looking at your budget to actual history, your operating history from a management perspective, as well as just your overall institutional framework, which includes state statute allowable, changes in revenue limits and that sort of thing. Then they're looking at your debt as a percentage of your tax base, and as a percentage of your overall revenue. And so when they look at all of those things and they put them into their formulas, they come out with the credit rating for Oshkosh School District, which is a AA2. So as we look at the rating scale for Moody's, the very highest credit rating available is a AAA. The second highest is a AA1. The third highest is a AA2, which is exactly where Oshkosh lands, which is a fantastic credit rating. So there's only 13 school districts that are rated by Moody's in Wisconsin that have credit ratings higher than that. The median rating for Wisconsin school districts rated by Moody's is a AA3. So you are a notch higher than what is the median rating for Wisconsin schools. And in their last rating report for the district, some of their comments included the fact that you have a large tax base with a university presence, that you have adequate reserves, that means fund balance and cash balance, a modest debt burden. And they look at the fact that you have had taxpayer support via successful referenda for operating. So they see that as obviously a very valuable attribute in Oshkosh, is that you've been able to get support from the taxpayers to exceed the revenue limit. And the one challenge that they do note is declining enrollment, although that is not something that is specific to Oshkosh in Wisconsin. Many school districts in Wisconsin are facing that very same challenge. Getting into some of those metrics, this chart is showing us your general fund balance over a 10-year history. You've established a policy at the board level of a fund balance of at least 12%. And we can see here that you're currently at about 16.5%. You've really stabilized the fund balance and grown it over the past 4 years, which is going to be great as Moody's takes a look at you again if you go to market for debt. You've been able to decrease your cash flow borrowing over the last several years. So that's another credit positive. The district has to borrow because of cash shortfalls through the year because we have choppy revenues and consistent expenses. And again, you've been able to decrease the amount you've borrowed for the last several years. You've been able to repay that cash flow borrowing quickly as well in late June once you get state aid receipts. So we see all of those as really credit positives. This is not only general fund balance on this next chart, but also balances in your Fund 73 or your post-employment benefits trust and your capital projects trust. So you started a capital projects fund 5 years ago. The red bar is showing us the balances in that fund. And this gray bar is showing us the balances in the other post-employment benefits trust. So this is just even more evidence of really a solid financial base in Oshkosh School District. So not only growing general fund balances, but being able to have funds set aside for capital projects, as well as growing the funds that you've set aside for that long-term liability of post-employment benefits. Here we have your outstanding debt. So by state statute, you're able to issue up to 10% of your equalized valuation in general obligation debt or debt that's paid back by the property tax levy. So your debt limit is over 575 million based on that statutory formula. Your principal outstanding is about 50 million. So this pie chart is just giving you an idea of your debt outstanding versus your allowable debt limit. Next, looking at your tax rate. So I think this is really interesting as well. The red bars are the state average tax rate for K-12 districts. Again, this is a 10-year history. And the blue bar is Oshkosh's tax rate. So your tax rate over the last 10 years is averaged $9.24, whereas the state average has averaged $9.94 over that same 10-year period. We can see that in almost every year you're below the state average in terms of your tax rate. And this is despite the fact, as we mentioned previously, that you've been able to go to the voters and get support for operating referenda. So you've been able to maintain a really low tax rate, despite having voter support for continuing the programs and operations that you're delivering in Oshkosh. And here we just have a brief summary of successful referenda over the last 10 years. You haven't gone to the electorate that much, particularly for facilities. So 2012, you had the referendum. I believe this was the Oaklawn Elementary School referendum. And then, of course, you've held a couple of successful operating referenda, which we'll talk about later in terms of going back to taxpayers and asking for renewals for those. But it's important to note that the one in 2014, that will sunset in the 2021 year. So 2020-21 is your last levy for that referendum of $3,950,000. And then 22-23 is the last year for the referendum that was passed in 2016. And that is a $4 million revenue limit override. So that was all specific Oshkosh information. Now we're going to just take a look at some metrics as we compare you to your regional peers. So this first chart is showing us debt service outstanding per student against all your regional peers. So we've got Omro, North Fond du Lac, Ripon, Menasha, Fond du Lac, Rosendale, Brandon, Winneconne, Appleton, Oshkosh, and Neenah. And what we're showing is referendum and non-referendum debt, because in Oshkosh, you have not only that referendum debt from 2012 for Oaklawn, but there were some energy efficiency borrowings that were done, and those fall in the non-referendum debt category. But even summing up both of those categories, we see that Oshkosh is second from the bottom in terms of how much debt you have outstanding per student. And it's important to note that these numbers, because they are as of June 30, 2019, would not reflect, obviously, Neenah's most very recent successful referendum for $114.9 million, nor would they really reflect Fond du Lac's successful referendum, since that was in April of 19. They wouldn't have loaded on the debt expense yet, and that was for $98.5 million. So we could expect, both Neenah, obviously, and Fond du Lac's debt per student to increase over the next couple of years as they load on the debt that was approved at referendum. So that's debt service per student. The next is your debt service as a percentage of operating expense, and your position on the ranking doesn't change. You're still second from the bottom in terms of how much debt you have as a percentage of your overall operating expense, and the same comment made there for Neenah and Fond du Lac, that not being reflected in the data yet. And then here's your debt outstanding. So whereas the previous two charts were showing the expense on an annual basis, this is showing actual total indebtedness outstanding per student. And we have Oshkosh right here, sort of in the middle. But again, making that same comment about, we have Fond du Lac and Neenah with very little debt outstanding as of June 30, 19. We know that those bars are going to grow rather significantly as the debt is issued for those successful referendum. Now I'm clicking all over the place. I'm sorry about that. And we took a look at your mill rate versus the state average. Here is your 2019-20, your current mill rate versus the same group of regional peers that we just looked at. So whereas you compare quite favorably to the state average, you happen to be surrounded by a lot of regional peers with also low mill rates. So you do fall, towards the higher end there. You're number 4 on this metric. The state average again in the current year is $9.37. You're at $9.22. Your area average is $8.92. That again is including NINA, so that expecting their mill rate to go up based on their most recent successful referendum. I believe some of Fond du Lac's debt is already loaded into their current mill rate in the 2019-20 year. So that's all I had as far as background financial information. Sue, I think we were going to switch over to have Bray talk about facilities.
Yes, and then we'll come back to the referendum projection.
But before we make that transition, Dr. Herzog, we wanted to hit pause and answer any questions that our board members may have, only because this is a lot of information to be reviewing at one time.
I have to say, when I read the staff report, I was very impressed with the financial update. It seemed to me that it reflected that this board and prior boards have been good stewards of the money that the taxpayers and grants have provided us. And I just was pleased to see that we were in the position that we were in or are in at this time. So thank you for creating those graphics and those explanations for at least for me to make it clear. Thank you. Any other comments at this time? I don't see any hands raised, so I guess we'll go back to Mrs. Schnorr.
Okay, now I think we will be turning it over to Dr. Gunlock and Clint from Bray.
Okay.
Yeah, we're kind of sandwiching this together. So we have the financial status that you just heard from PMA, and now Clint's going to go ahead and present some information on the work of the Facility Advisory Committee, the consolidation plan. And then I'll step in. We'll, of course, give the board an opportunity to ask some questions again. And then I'll step in and discuss a little bit about the referendum for learning continuation. So I'll turn it over to Clint at this point.
Thank you very much, Dave. And thank you, board, for the time this evening. With me as well as Matt Wolfert from Bray Architects. And can everyone see my screen, by the way? Great, thank you. So we just wanted to give an overview. Some of a good chunk of this is going to be a fair amount of review for the board. Again, not taking anything for granted for any community members that might check out tonight's board meeting. We just did want to kind of give a little bit of an overview of where we've been, because it's been a relatively long process to get here. Starting just with the pure facility analysis that was done, just looking at the conditions of all of the buildings. But really kind of the jumping off point we wanted to start with today was the Facility Advisory Committee work that was done in the fall of 2019. So starting there again, we had a charge for that committee. That committee was made up of a very diverse from Oshkosh residents. So it was very purposeful. We wanted to make sure that everyone was represented from business leaders and various members of some of the city organizations to just retired citizens that are engaged in the school district, parents, and as well as other different various groups, making sure that we had, again, a good cross-section in all regards. That board, or that group, was charged by the board with a number of different things. And again, up here on the screen, We wanted to make sure that our environments were safe, accessible, efficient, equitable, purposeful spaces that innovate, that inspire innovative learning, and then maximizing the facilities that we have, and then recommending or looking at potential replacement of existing facilities. Again, that group met over the course of 6 meetings from September through early November, and that ultimately culminated in a community survey, which again, I'm not going to share those results again, but the community survey was great feedback from, again, a large cross-section of the community. One of the major components of that facility advisory committee, and really even the work that the leadership, district leadership team did prior to that, was trying to identify what is the most beneficial organization and structure for our schools, and specific to the elementary schools, looking at 3 to 4 track elementary schools. And then for the middle schools, looking at a 8 to 10 track middle school. Again, in terms of size, the elementary school, it's roughly about a 450 to 600 student elementary school. And the middle schools, again, right around a 8 to 900 student middle school. Again, a lot of the parts and pieces of this is just the efficiency of usages of the building, the ability to have staff available to meet and discuss different student needs, the flexibility to move students so that they're not in a sort of a single track school where there's only one grade level. There's a lot more flexibility in how you can place students. And then one of the really critical things is just having full-time staff in most areas, if not all of the areas within the building. So it eliminates traveling staff and some of those needs that occur in smaller schools. Ultimately, the committee came forward with an executive summary that was presented to the board in December. And a number of the elements of that, again, was to commit to a long-term consolidation effort, adopt a pathway B, which would take the district from currently 20 facilities to 14. And then again, kind of the findings of that was to pursue a capital referendum, and then engage the community in further looking at a phase 1 middle school and elementary school project, specifically on the north side of the district. Another piece I wanted to touch on this, and again, this was part of a presentation earlier this year that I did for the board, was just again looking at some of the benefits of modern facilities. Again, there's kind of the adage, you know what you know, but you don't know what you don't know. So again, if you recall, we kind of had a series of slideshows where we just looked at some of the other learning environments, again, that your peers throughout the state are considering and implementing in their schools. Again, I'll kind of go quickly through these, but again, just wanted to kind of remind the board of, again, I think some of the excitement and seeing some of the opportunities for flexible learning spaces, specifically the integration of furniture and technology in many of these spaces, and some of the personalized learning environments that you're able to create. Again, there's the ability to meet in larger groups, medium-sized groups, and as well as in very small groups or one-on-one with students in specifically designed spaces. Also looking at libraries and really how libraries have responded to modern learning and creating very comfortable learning environments. I often joke they're becoming more and more like Starbucks without the coffee. And although in some high school environments we are seeing the coffee be implemented as well. But again, very flexible spaces. As much as it hurts librarians to hear this, it's less about the books and again, more about opportunities for students to learn and work together in groups. STEM, STEAM, and Fab Lab type spaces, again, creating career college ready students and workforce. Not all students go to college. Many of them will gravitate directly into the workforce. So again, finding opportunities to meet those students' needs, the employers within the communities. And again, these STEAM and STEM spaces play a vital role in trying to fill those needs and creates individualized, specialized learning in the technology and science, technology, engineering type environments to, again, meet the skills demands that are present in the communities. And then just community spaces. Again, the schools, as you experience right now, really are the hubs of each individual neighborhood. They're very, very important. And that really isn't changing moving forward. We really think of these spaces as being utilized on all hours of the day and every day of the week, nights, weekends. So again, the ability to create these spaces that are flexible, that support one another. The cafeteria supports the gymnasium. We're able to lock off classrooms from the rest of the building. Again, creating spaces that will support community use. So again, a reminder of where we came out of the Facility Advisory Committee with the consolidation plan, which we called Pathway B. This first diagram shows the current configuration of the 20 facilities throughout the district. Again, with the 7 elementary, 3 middle, 1 high school on the west side, and the 6 elementary, 2 middle school, and single high school on the north side. Pathway B looked to, again, consolidate buildings down to 14. So it would have 5 elementary on the west side, 2 middle schools on the west side, and then again, preserving West High School. And then the north side would be 4 elementary going down to 1 middle school, and then the single high school continuing to function. Again, phase 1 of this process really focused on the north side solution for the elementary and middle school. So looking at a new middle school, likely at the Merrill site to consolidate the 2 current middle schools, and then a new elementary, again, likely at the Webster site, which would consolidate the Merrill, Webster, and Washington buildings. Again, as it notes, the buildings that would come offline in most cases, again, Webster and Merrill would be demolished to accommodate the new construction of the facilities. The other buildings, such as Washington, we would look to potentially sell or find a new use for those particular buildings. So this is kind of a narrative description of that. Again, with point number 5, again, the future use of Washington Elementary is to be determined. I'm jumping ahead of myself a little bit, but we've had some preliminary discussions with the city of Oshkosh regarding kind of this overall plan, and I think kind of their initial impression of the opportunity for what Washington could become and be utilized for. There was some excitement there. So again, I think that's something moving forward that could provide a lot of benefit for that community. So again, phase 1, again, coming out of the recommendation from the Facility Advisory Committee. In addition to the consolidation efforts, there were sort of 2 other project pieces within that. So again, the 4 projects coming out of that were district-wide safety and security improvements, the new elementary school at the Webster site, new middle school at Merrill, and then district-wide infrastructure updates. So we'll kind of go through a summation of all 4 of those. First being district-wide safety security improvements. So the chart up here is to try to kind of, in a very quick bite-sized version, sort of describe what projects and kind of the magnitude in terms of a budget that we would be looking at for all of the facilities. Just want to kind of point out there are a number of schools that we've identified, in the kind of the gray bar color, and those are represented in that way because Again, as we look forward in this process and towards future phases, those would be schools that would come offline at some point in time. So I think one of the questions the board will need to grapple with is, again, does it make sense to spend taxpayer money on those facilities when they again are anticipated to come offline in the near future? I think the easy ones are, Merrill and Webster, very much so, because those would be immediately addressed in phase one as well as Washington. But some of the others, again, there may be some debate and questions if those would need to be addressed. The recommendation or the way that we're looking at this in terms of the financials this evening is that the items in gray are not calculated in the total and then would not be part of this phase of work. Again, also just another item to kind of point out is that some of the improvements specifically at Webster and Merrill are as they're shown, are kind of our best attempt to try to address the safety and security. Merrill in particular is a difficult school due to the multiple levels and the lack of ability to add on to the building on the front side of it. And again, some of the logistical challenges with that facility. So again, we more the reason again to kind of look and consider those for future replacement. Just to quickly give you a couple of examples of what this looks like in particular, we have a elementary example, a middle school example, and then I'll show both the high school projects. The current office in Reed is in the area here shown in the red color. So again, this was the traditional location for offices. You put it in the center of the building. They're accessible to students. It's a great location from a educational perspective. However, from a secure ability to monitor the front door, it really just doesn't function very well in the center of the building. So you're going to see kind of a prevailing theme in all of these where we pull the office to the exterior of the building. In this particular case, we are suggesting an addition for the office to be housed within. There'd be a secure entry vestibule that would let people into the building, and then they would be forced or funneled into the office to check in before they're released out into the school. So kind of the sense that you're allowing people into this space before you're going in. If you've been to Oak Lawn specifically, that building is set up in this manner. So for a frame of reference, that's kind of the concept that we're going for in this particular case. The existing office space, then we would renovate to create some staff space as well as some sensory space for the school. South Park actually works pretty well. This is a situation where the office currently is on the outside of the building. Just the challenge with that facility is you have to kind of go into the building. You have to allow people into the building before they can get to the office. So really the solution here is to reconfigure, renovate the office so that we can get direct access from the vestibule into the main office, again, for that process of checking in. So again, many of the schools are along this vein where we're able to make the accommodations via renovations rather than an addition. So this is kind of a good example of that. Not all of these projects require additions. North High School is one of the projects that does require an addition. Again, we are in a situation where the existing office is central to the building. Again, the part of the project here too in looking at the offices, and I should say this for all of the grade levels, we had several meetings with principals to again get some buy-in from a conceptual perspective that these what we're proposing is meeting their needs. So from an overall building perspective, again, this would be a new addition that we would put on near kind of outside the cafeteria at the main gym entry. And then the existing portion of the office would get renovated, in this case, for some additional classroom and classroom collaboration area, as well as providing some in-school suspension. And then kind of a neat thing and ties into the earlier conversation is we would allow the existing office to be a social worker mental health space with, and this name really struggles with me, but the Catalpa group would then also be housed within that space. So on the right here, you can kind of see a blow up of that space. So this works well as the secure entry with funneling into the office. We're moving the bank out to this location, the health or nurse areas within here, as well as offices and conference rooms. West High School probably represented the project with the most conversation. We looked at a number of different options here. There was a very early addition project that was considered here, again, because I think this is a facility in a later stage of phasing that I think the district would like the opportunity to maybe take a look at a replacement of West potentially. That we really tried to make sure that a renovation type option would work and suffice for the needs of this facility. So the renovation is kind of isolated to the center. I'm going to kind of go to the next slide. So the offices, guidance, and student services are currently housed in this bar, which is just off of the hallway to the library. And the plan would be to create a new school office location, add a new front door, again, creating a new secure entry, again, with that sequence into the office. And then due to the proximity, again, staff really wanted student services and guidance to be in close proximity to reception and close proximity kind of to the new front of the building, so to speak. The plan then takes the classrooms that are currently in this location and flips them over to where the current offices are. And we're able to create a guidance and student services space that will work well to allow them to have a separate area, but also flow and work together and potentially share some resources. One of the discussion points of this concept is parking on it's Eagle Street, right, Dave?
Yes.
The parking on Eagle Street, signage and that type of thing. So again, we've had some preliminary discussions about that and trying to make sure that there is parking and there is good accessibility to this new front entry location.
Okay, my name is Christy Levy. I'm the principal at Washington Elementary. At this point, we're going to talk a little bit about how building principals were brought into the design process so that we could give feedback, ask questions, and start to really figure out how we bring together the form of those beautiful building mock-ups that we saw with the function of what we do in our building every day to serve students and families. Beth Galeazzi was also brought in for the elementary side of that committee. She's the principal at Webster Elementary School, but had a prior commitment tonight, so I'm kind of summarizing for the both of us. So we just collected some of the pieces that we felt were really important that came directly from building staff that went into those design pieces. And of course, we started with enhancing the building safety. And a big part of that was really conversation around how do we make our buildings continue to be a welcoming space for visitors and families, but add some of those security features in so that we have just a better flow process of who's entering the building. And then once they're in the building, where are they going from there? And part of that is centrally locating those offices so that we can provide them the easiest access with the most ability to screen who's coming in and out. Everything else that you see on the bottom of the slide really starts to talk about how are we aligning our physical spaces with our philosophies about what teaching and learning should look like, especially given that we have really young learners. The first bullet point really talks about some of the concerns that we've heard from families in our smaller neighborhood schools when they say, I'm feeling a little anxious that my child would be going to a much larger school. And in having really great conversations with our families, what we've learned is that what they're really asking us is, how can I be sure that somebody is going to see my student every day How am I going to be sure that somebody knows him or her, that they have that connection, that they have that relationship? And we heard pieces of that in our prior workshop as well, when we were talking about the mental health services, and that the crucial component of that relationship with an adult staff member. And so that question that we get about merging into a larger school really isn't about numbers. It's about how am I going to make sure that my child still has that important relationship, and how am I going to be sure that staff know them? And so for us, it was really important to look at the physical design and layout of the buildings and make sure that we were structuring them in a way that allows us to support smaller learning communities. And so at the elementary level, that means can we group grade level cohorts so that, for example, our kinders in first grade are in a central location that feels like a smaller part of that building, and so on and so forth for first, second, third, fourth, fifth. And then within those spaces is their collaborative workspace so that students can pop in and out, so that they have easy access to their grade level peers, so that we can be more fluid and flexible in terms of how we educate students, and kind of break down the barrier of this is your classroom and this is where you will be all day, but really allowing us to get more creative and be more flexible about how we meet learner needs given those spaces. In addition to that, we tried to follow those same premises when we talked about collaborative spaces for staff and for community members. As silly as it sounds, when we go into some of our buildings and we recognize the value of professional collaboration and how we all grow and get better together, when we don't have a physical space for professionals to collaborate, that can be really challenging. So just trying to think of all of those pieces that would need to fit into all of those spaces. Again, and this kind of goes back to the safety piece, the strategic placement of media centers and offices, recognizing that media centers, offices, gyms are often the hub of our school, both for internal happenings in terms of support for students and staff, but also for our visitors coming in and out of the building. How could we strategically place them so that they're easy to get to from the outside of the building, but prevent people from having to walk through the halls where classrooms are located and learning is happening if they're attending for a special event. The next piece is we really paid close attention to playground equipment. Many years ago when playground equipment was installed, it was the responsibility of outside organizations such as PTO to fundraise for those spaces. And I really think that philosophical shifts have happened over the last several years that really start to recognize the value of gross motor development, and some of that purposeful play that happens on the playground is an extension of learning at the elementary. And so kind of breaking with past practice and making sure that that playground equipment is planned for and that that's part of the original construction rather than something that needs to be added after the fact. And then the last one, most importantly, coming from a small school where we are serving a smaller population of students, we really run into a lot of challenges related to access to critical staff for our students. And so when we talk about the role of a school psychologist or a social worker or a school resource officer, our behavior interventionists, our support for English language learners, all of those other pieces in a small school, if 1.0 is one person there all day, every day that can provide those supports to students and families, we might have like a 0.2, which means that we might have a school psychologist on site, for a half a day once a week. And we might have a school social worker on site in our building a half day in the morning, one day, and they might pop in a time or two just to try to catch up. And so what that means for our students and our families is that if they're struggling with something and it's Tuesday, they might have to wait until Thursday before that person is on site, unless we can pull them from another building. So really bringing all of the children under one roof means that we can bring all of the supports that they need under that same roof. So they're all in the same place at the same time.
Thank you, Christy. So one of the things we before we get to the fun architecture, we have to do some spreadsheet architecture. So taking into account, again, all the goals for these facilities, we created building programs that tried to catalog and list out, again, our goals for all of the spaces we would like to include within these projects. So again, that included the special ed spaces, the resource spaces. So we spent a lot of time, again, with district leadership to going over these. The cliff notes, if the kind of going back to my days of learning version of this is what we hope to get out of this is really an identification of how big our building needs to be or wants to be to accomplish those goals. So in this particular case for the elementary, we're looking at about 118,000 square feet for the facility. Now we start to get to a little bit of the fun stuff here. So again, taking that, we've worked again a lot with district leadership and then the principals to start to lay these buildings out. And again, these start to look like final floor plans, and by no means are these final. There's a very long process that we will go through in creating these floor plans. But again, the floor plans were an attempt to try to meet a lot of the goals that were stated on that initial sheet and as Christy described. This is the new elementary school, at the Webster site. The Webster building currently sits kind of along Hazel Street, for those of you that are not familiar. So again, we'll get a little bit longer in the process, but and we'll describe the scheduling of this, but actually this part of the project actually is the last piece. The Webster building would get demolished before we would start construction on the new facility. So again, in terms of site, we would utilize Grove Street, kind of the back of the site, so to speak, as our parking and drop off. This would be drop off for parents along this loop, as well as our parking within here. Melvin currently is utilized as a drop off area. That would also be a secondary parent drop off location. Hazel Street, again, given that the lake is to the east here and to the right of this image, I mean, this is really kind of the front of our building. We really want to try to capture the views towards the lake and towards the park across the street. So the access that we're showing here is really intended to be visitor parking. The office is located kind of in this front and center location along Hazel. So this parking is intended to be a visitor parking type location where people are coming to the office. The last kind of vehicular or face of the site then is Seaward Trail, and this would be our bus drop off location along here. As mentioned, then we really have a location where some of the public parts of the building, the cafeteria and gymnasium, are closest and accessible to this parking. So again, for after school or special events, it is near to the parking area. I'll get to the floor plan quickly and kind of describe how that organization lays out, but then the central piece here is where our playground and some of the open space will be achieved. Again, we've talked a lot about open space and making sure that we maximize that. So the building as proposed would be a 2-story building to try to limit and give ourselves some green space when the project's completed. So looking at the floor plan, again, as Christy alluded to, one of the goals was really to break down the scale for this building. So again, the sense or perception that this is a large elementary school, again, a 450 to 600 student elementary school is pretty typical throughout the state. But again, in an effort to try to break down the scale and create smaller learning communities, each of the wings of the buildings right now is set up as a grade level space. So our second grade, our first grade, pre-K, kindergarten, fourth and third on the second floor, and then fifth grade. And each of these learning communities, again, have a dedicated toilet. They have their locker area. They have a resource space that again, is all sort of specific to their each individual learning area. This circulation spine kind of coming through the building then can kind of be viewed as sort of like Main Street, meaning this is what the students are utilizing to get to art and music. But again, a first grade student does not need to go into the second grade area to get to the various places that they need to get to within the building. They have a pretty direct route, and again, they're sort of in their own realm within the building. Administration, we put in the center, again, kind of going back to that initial philosophy I described when I had the Reed floor plan up, that we want to put it at the middle, at the hub of the building, but it is also, in this case, at the exterior and creates that secure entry that we want to try to achieve within the facility. And then again, the cafeteria and gymnasium, allowing some ability for those two spaces to work together and support one another for during school events and after school events. In this case, we are showing the library and some STEM space up on the second floor. Again, we're second floor housing 3rd through 5th grade. You'll notice the SEs kind of shown throughout the plan. Again, one of the goals, we didn't necessarily want to, SE stands for special education. We wanted to make sure that the grade levels had that available to them very easily and accessibly without, again, going to a remote location within the facility. With that, Ryan and Phil will kind of talk about some of the objectives then for the middle school side of things.
Well, good evening, everybody. I'm Phil Marshall. I'm the principal at Webster Stanley Middle School. And as Clint said, Ryan and I are going to just kind of discuss some of the conversations we've had in putting a design together for the Northside Middle School. So what Christy said really kind of applies a lot to what we want for the middle school as well. First and foremost, we're wanting to ensure that we have all the modern, safety requirements and security features in place. That is obviously very important to us. And then after, considering that, we had a lot of conversations because, this could house 850 to 900 students at the middle school level. And so that's a large school. And so the conversation came down to, well, what can we do to try to create a design that might make it seem smaller for the students? And so what we have looked at in the design and what we're kind of proposing is that there would be 3 stories in the academic section of the building, and each story would house a grade level. And within that grade level, there would be 2 sort of teams. And so they would be divided into 150 6th graders, let's say, on one side of that academic area on that floor, and then another 150 on the other side of it. So there would be all of the things that they would need would be on that floor. There would really be no reason for 6th graders to need to go up to the 7th grade floor or the 8th grade floor. The only reason they would really need to leave that area is to go to the common spaces, which would be obviously cafeteria, gym, the tech ed space, the STEM spaces, that type of thing. And then being able to kind of create those teams of 150, we felt we would be able to kind of create that smaller learning community, kind of keeping them close together. And, really being able to work on building community and relationships with students. So that's been kind of our answer to a big question about, the size of the building and how we can build a community inside of it to meet the needs of our students. And again, we really want to be able to promote 21st century learning. Our buildings in the condition they're in right now are really limit us in ways that we can do that. So again, we want to be able to create those flexible educational spaces. Being able to kind of, if you can kind of picture like the classrooms kind of on the perimeter of an area, and then having sort of a central area outside of those classrooms where there can be some, smaller groups that are maybe meeting or having a reading space, or, just something like that. Also, just being able to have flexible seating and places for just unique places for kids to be able to learn and enjoy the school experience. And then also, we just want to make sure that we have ample small group instruction spaces. I can attest firsthand at the needs that we've had. Webster Middle was one of the first Catalpa schools to be able to host Catalpa, and it's been such a tremendous program for our building, but we didn't have a space for it. And so, you need to be able to, the requirement is that you need to have kind of a discrete area. You don't want to have, the students or, to Catalpa, their clients, being, escorted through all kinds of places that they can see, oh, they're going to go see the, counselor or something like that. We want it to be discreet. So we've had to be very, creative in coming up with these kind of small group learning areas. And, we've taken closets, we've taken, storage spaces and everything we can to just create a space. But how nice it would be with the needs that we have in the 21st century to be able to have, adequate lighted spaces for those small group meeting and instructional places to go. Also, just, having a number of special ed students. Webster Stanley, currently we have about 24% of our student body are special ed. And so we, have a need for those kind of small group areas where, maybe they're integrated in the classroom during, a certain period, but maybe there's a part in the lesson for maybe 15 minutes that maybe a specialist or a paraprofessional might want to pull a group of students to be able to go and work on something as a small group, instead of just doing it in the hallway, being able to have an adequate space to be able to address those needs. So those were some of the design features that we really talked about and had a lot of conversation. And so this was kind of our presentation to you, and I'm going to turn it over to Ryan for the remaining bullets.
Hi, everyone. I'm Ryan Peterson, principal at Merrill Middle School. First, I would like to just start by saying thank you to the exec team for including us in on this conversation. I think as we talk about not just talk about, but really dream about what a new facility could look like for our students, I think it's really, really important for us to be able to share our students' voice in this, because we share a common experience. We walk into our current facilities with them every day. And we want to make sure that the design of this particular building and the design of buildings in the future within our school district really meet the needs of our students. And that we can help be there to kind of guide what that design will look like, that it just best suits the needs for our students. So a lot of the discussion tonight was about just how do we create smaller learning communities, and how do we create a connectedness for our students now back to our schools, whether it's the elementary school or our middle school student or middle school as well. And a big part of that isn't just simply the breakdown per grade level or just the intentional grouping of where students go. A huge part of that is when we get to the economy of scales with an appropriate size school where our staff can help support those students all the time. I know Christy talked from a very small school perspective in regard to having a social worker that visits them maybe a half a day on a morning. I can tell you, as the principal of the largest middle school in town, we experience the same things every day. There's a lot of fragmented support for our students right now. We have a shared school psychologist. We have a shared social worker. We have a shared school resource officer. And when we have positions like that, it's really it creates an added element for our students to feel more connected to our schools. And so one of the big parts and one of the big discussions was about how do we appropriately staff a school of this size to ensure that our specialists are there and they're dedicated to our students so that they can support our students all the time. And I think that is just one of those critical elements in order for our kids to feel connected. It doesn't matter if there's 600 or 800 students. If we have compassionate educators in the building that really get to know the kids, really develop strong relationships with those students, it makes all the difference in the world. And as we can design buildings that offer opportunities for us to do that, it's just an efficiency that would be hard to pass by for sure. Another part of the design of this particular building that was at the forefront was just talking about where things are located, putting our pupil services team and our administration closer. Again, I'll echo what I already said about building relationships with students. When our pupil services staff and our administration are located in the center of a building with a main corridor, like you saw in the elementary school, and you will see in the mock-up coming soon here, it really gives us opportunities to better connect with our students and just be more responsive to their needs as well. Another big piece of this was just the idea and the design of how can we create spaces that are one, good for students, two, good for our staff so that we can better support our students, but also how do we create spaces where our community really feels connected to the building as well. Historically, the schoolhouse has always been the center of any community. And, there have been times in more recent history where we've gone away from that, but the design of this building, that's been a central piece of this, is the discussion about how can we bring the community back into the building. Clint mentioned it earlier. How do we use it in the morning, in the evenings, on the weekends? And with this particular building and the building design here, it includes a lot of space for just collaborations and meeting, whether that be for the community or whether it be for our staff. And then the building, when you see the mock-up of it, it's quite impressive because it's really oriented toward the community with, again, playground equipment, meeting spaces, a large gymnasium that our rec department can use. So hopefully the design that is put forward here suits some of those needs for us that we really are looking for.
Well, thank you, gentlemen. You've painted a pretty good picture. I'm not sure I even need to show the plans at this point, but I suppose I need to. Again, much like the elementary school, again, a lot of those goals need to first kind of get vetted through the programming process. Again, with the ultimate goal to try to figure out how big this facility will ultimately be. So again, you can see we're about a little over 180,000 square feet for our middle school in this case. So the site plan, again, going through a site plan process and then a floor plan. So the plan on the left here shows the overall site. So again, to orient you, the current Merrill Middle and Elementary building sits on the lower right-hand corner of the site. And then the district-owned property with the track and some of the ball fields is in the upper left quadrant of the site. So the goal for this project is to build the new facility while the current Merrill building will remain in function. The Merrill building, again, during the initial construction, the Merrill and Webster buildings in Washington would basically function as they currently do. When the middle school is completed, then all of the middle school students would go into the new facility, and then Merrill would be temporarily an elementary school for Webster and for Merrill while we demolish Webster and rebuild the new elementary school there. So that's kind of the sequencing of operations to get us to a final product. As mentioned, the yellow again is our new facility up here. So again, kind of describing some of the goals for the site. Jackson Street is a very busy street. So our approach to that is to try to limit any vehicular traffic to that as much as possible. Right now, we are showing kind of a connection for receiving off that backside. Again, a lot of times the receiving, garbage pickup and stuff like that occurs sort of early in the morning or apart from some of the goings on of the rest of the school. So again, we're hopeful we can utilize that to keep kind of the back of house things away from the kind of the busy side of the facility. Nevada Avenue, the plan would be to allow for some bus drop off to occur along that street face. So again, there's 6 or 7 buses that we anticipate that would utilize the drop off space, and that would occur along Nevada. And then the plan right now would be for Kentucky Street then to be the main parent drop-off location. The new main entry then would be on Kentucky. So to Ryan's point, sort of facing a little bit more towards the community versus and away from kind of the busy Jackson Street is kind of a little bit of the approach in this particular case. And then our main parking space would be on the south side of the site. This works really well because when we get to the floor plan, you'll see a lot of those community-oriented spaces are on the south side of the building. So again, parking right where it's supporting kind of the bigger assembly type spaces within the building. And then it also potentially supports whatever type of athletic fields that we would elect to utilize with the current Merrill building site. And generically right now, we're just showing that you could fit 2 full-size soccer fields very easily on here. Again, we haven't gone into the specifics of if there's going to need to be a track replicated here or if we need any other different types of ball fields. So that's kind of the overall site. Again, kind of zooming in, you could see again the kind of the comment Ryan made about some of the activity being on this new entry side with again some playground space, the new main entry, and those types of things. With that, then I'm going to kind of click over to the floor plans. So as Phil mentioned, the building is a 3-story facility. And the 3 stories, as he again mentioned, are the first floor would be our 6th grade, second floor would be 7th grade, and then the 3rd floor would be 8th grade. The pods that he described are the 2 team approaches, is you can sort of see that there's 6th grade classrooms, again, huddled around kind of, again, a resource space, bathroom, teaming space within on one side, and then again, that's replicated on the other side. So again, these 6th grade students could really function in this grouping apart from the other groups. And then much like the elementary, there is kind of a main street that runs through the facility that connects the various grade levels then to some of the encore, band, choir, the gym, art and STEM being down in this part of the facility. The office and student services is in the central part of the building, so very accessible, very available. Again, kind of going back to that original theme where it's really in the heart of the building, but it's also providing that connection to the exterior and creating that secure entry situation. Much like the elementary school, we're trying to create kind of a zone of the building that's more of a public zone of the building. So again, the cafeteria, gym, in this particular case, we do have a community room type space that we have assigned within the facility. And then again, band, choir, orchestra generally have some degree of relationship to those public zones of the building. One change that again kind of came out of the staff meetings and meeting with the principals was that 7th grade was some of the FACE courses are really heavily focused on the 7th graders. So one of the changes we made kind of coming out of a meeting was to locate family and consumer ed rooms on the same floor as 7th grade. So again, there was that need that the classrooms and the subjects were right where hopefully the students need them. One other thing I didn't mention was that Each level does have a science, a room designated as science. That room again was located in the middle so that it is shared by both pod group have access to that. Again, then back to kind of our four goals for this phase one. The last one is the district-wide infrastructure. So Jim and his team have worked to put together this list. Some of these items, again, coming out of the Facility Advisory Committee, should look familiar in regards to some of the electrical service upgrades, as well as some other needs for HVAC, fire alarm upgrades, generators, and some roofing projects within the district. So again, this total overall infrastructure budgets, is just a little bit over $9 million in total. So total budget then for phase one, the secure safety and security projects, again, right around $9 million. Our elementary school and middle school, we did look at some of the detailed budgets with the exec team and the principals, and I guess I just kind of wanted to point out a number of items within there. Again, those budgets include obviously the construction of the facilities. They include the playground equipment, which is again one of the items that actually originally came out of the Facility Advisory Committee. Was we had to make sure that playground equipment was included in the project. The budgets include demolition of the existing facilities. We have an allotment in the budgets for what we assume to be some environmental needs, asbestos and those types of things. As well as at Webster, our understanding is there may be some soil conditions there that might require some additional structural needs. So again, we're trying to create a budget that is as holistic and complete as possible. In addition to that, the budgets also do have some allowances for inflation, recognizing that we're not going to be building these tomorrow. We're going to be building these a number of years out, so that there is inflation incorporated within that. So that again, we're looking at what we think construction prices will be in a few years. So again, our total overall phase one budget is about $107 million. This diagram is intended to be kind of to show the schedule that this whole process would go through. The secure entry and infrastructure projects, there will be some design process that's involved. So this schedule assumes a November referenda start, or a successful November referenda. So there would be a design process, and the goal would be that the infrastructure and secure projects would take place over the course of 2 summers. So some work would be completed over the summer of 21, and the remainder of the work will be completed over a little bit of an extended period in spring and summer of 2022. As I mentioned when we were talking about the Merrill site, there's kind of a staggered process for design and construction of those 2 facilities. So we would actually design the Merrill Middle School first, put that out to bid, and then start construction in the spring of 2022 with completion for the start of the 2023-2024 school year. I'm sorry. Yes, that's correct. Yes. And then we would, once the project is out to bid for the middle school, we would design the elementary school, and that would then be complete in August of 2024. So again, kind of forecasting out for those inflation costs, because recognizing that, again, the construction costs are going to change as we look that far ahead. And then the final piece over that once the Webster project is done, there would be some site work that would need to happen at Merrill to tear down the existing building and then do the field work for that facility. Kind of again, looking ahead, one of the questions is going to obviously, given the current state of affairs in the world, is why now? And again, that's going to be a very difficult question that the board is going to need to wrestle with over the next several months. And as we think about from the construction perspective, there's a couple of factors that I think are worth considering. Again, our estimation is that the interest rates on bonds for school construction continue to be at historic lows. Again, we don't know where it's going to be a few years from now, but that's a positive. We anticipate, again, while we have an economic downturn, we do anticipate that the bid market's going to be very competitive in the next several years as we're kind of rebounding, likely from an economic downturn. So again, we do see the bid market hopefully being very advantageous if we do have work out there. Another piece of this is, and I think really the big vital piece, and we talked about it early on, is you have aging facilities. And is the direction that the district wants to go in to continue to invest significant money in updating 100-plus-year-old facilities? Or is now the time, again, to look at potential replacement for those facilities? So I know from the financial side, there may be a few more why nows, but again, from the kind of purely from the construction side, those are a couple to consider. Again, I think this was going to be a spot where we were going to pause. I know that was a whole lot of information, so I can jump back if there's any specific questions. Again, I will point out these plans, while they maybe look kind of final, or these are very, very still very schematic, and there's a long process ahead of us to make these right.
Thank you, Clint. This is Barb. It's true, you've presented us with a lot of information, and I'm sure that there are other board members who are chomping at the bit to jump in here. But I want to commend all of you who have been part of this. We received a very extensive report from Bray and Associates, I believe, in the fall of 2017, which outlined over $100 million of work primarily on the exteriors of our buildings, to include roofs, tuck pointing, basements, and so on, and did not address preparing our students for the 21st century, in which they now are and will live their lives, compared to the buildings constructed in the 1950s for children who were going to become adults and spend many of their working years before the year 2000. You raised some very interesting points, and as I said, I'm sure the rest of the group is chomping at the bit here. We can't forget the fact that we charged the Facilities Advisory Committee and intended for that to be a diverse group to bring us a report, which they did in December. We thought in January of this year we would be having this conversation and discussing referendum, and then a community group had suggested that we broaden the scope of what we were looking for, and so we are at this point now. I was going through some papers today, and I came across a document called Board and Administrator for School Board Members. And this document talks about several roles of a school board, and we've talked about these before. One of our primary roles is to hire and supervise the superintendent, to develop policy, and to serve as an advocate. But it also had one additional point that we don't always hear, and that is they define the board as being responsible for the district's future. And a lot of that is strategic and long-range planning. And sometimes it's difficult to do that in terms of the day-to-day operations and the unexpected, like pandemics that get thrown at us. But we do have an obligation here as a board to look long range and plan for the future, a future which many of us may not see till the end. That is, many of us may not be around for the end of the buildings being proposed tonight, but we do have, I do agree with that. I do believe we have an obligation to look long-term. So with that, I want to give my fellow board members an opportunity to speak, and I'm looking and trying to find your pictures right now. Let's see here.
Looks like Ms. Carlin would like to speak at this point.
Please do, Miss Carlin, while I'm trying to find you on my screen.
Can we get out of the screen sharing?
Yeah, I can't see anyone either.
Sure, I'll see if I can stop sharing. How's that?
Thank you. All right, Mrs. Carlin.
Well, I'm about to ask an impossible question because we have never had a pandemic before, and I don't think anybody knows the answer to the question that I'm about to ask. But, you know, given what's happened in these unprecedented times, is this a good time to go to referendum on the November ballot? That's the elephant in the room that I think we're all thinking about. And I don't know, but I think we have to ask that question given, you know, a lot of people are unemployed and businesses are failing. And is the community going to be able to support something that will increase their property taxes? And I don't know. I'm honestly just asking this because I know that that is a question that we will all get.
If I will, I'm going to answer that in a couple different ways. I'm going to answer a little bit, and I'm going to ask for Dr. Gunlock to also provide an answer to this as well. One of the things that we have to take into consideration are a few things. One is we know that even given the pandemic, some of the needs of our students are going to increase. I don't see that decreasing, especially when you're looking for like social emotional needs, mental health needs at this point in time, because of the stress of some of those things that are happening. With us being spread out so thin, we're not going to be able to really address those needs in an appropriate manner. So that's one point to take into consideration. The second thing to take into consideration is also we are obligated to our taxpayers to be good stewards of our tax money, correct? And when we're operating as many sites as we are right now, we are not at that level of operational efficiencies of which we could be. We are facing a potential cut to our budget coming from the state. Knowing that, then how do we operate different without doing something different? So those are some things to be taken into consideration as well. Additionally to that, Merrill's 100 years old. Our rec department is 120 something years old. The facilities are not going to stop aging. They're only going to continue to age. And either we do something about it, we're not going to have a choice. We're going to have to do something. Either we address and put money into an old facility, or we look to construct a facility for the next 100 years. Because in all, that seems to be the pattern for our school district, is that we build facilities for 70 to 100 years, lifetimes. It's just we've hit that point, at least at the Merrill site, where we've hit that maximum use of for that facility. And again, I want to hit it three ways. One, we're not able to serve the students to the level of which they have a need for, because we're just spread out too thin. And some of our schools are just too small. It's not only serving the needs of our students, but it's also, if we want to remain innovative and pressing forward, which is what we are committed to doing, then how do we put up the systems in place in order to allow our professional staff to be able to have the right resources, to be able to have the right conversations? Because when you're in a school and you're the only kindergarten teacher, You do not have those type of opportunities. So that's the first level. Second level, again, going back to operational efficiencies, because when you're operating a lot of schools and you're paying for people basically for windshield time to go from school to school to school, and mileage included on that, and you're not really reaping the benefits of having someone at a facility full-time, that's where we struggle as well. And then the third one being the age of it. And then to bring in what Mr. Sell was talking about, Clint, right now we know that, when we're looking at interest rates, we're looking at construction costs, probably this is the better time to do it. And lastly, what I'm gonna bring up is districts around us are building new schools. They are not sitting with old schools, not being able to serve their students, not being able to serve their community needs. And so they become magnets in order to empty out Oshkosh for select families that can do that for open enrollment. So those are just some of the points. Ms. Carlin, you look like you want to say something else. I apologize.
No, that's okay. Yeah, I agree with everything you just said. And as you know, I've been a big supporter of us getting some new buildings for a long time now. So I'm not asking these questions in the sense that I'm not supporting it. I'm just asking questions that our community is going to ask. And you raised another good point during that we need to talk about while you were talking. And that is about, are we going to get any pushback about building bigger schools in an era where we are going to try and reduce class sizes potentially, or have less kids in buildings? And, I have no idea. So I'm looking for guidance from you on that too. And what is our explanation as to why we would want to build bigger schools after the pandemic?
Right. And again, if you'll notice the way in which things were laid out, we actually kind of were setting like schools within a school concept, where we were making sure that we had what would feel like an a large school within Oshkosh, but is really about an average size school across Wisconsin. We're really intentionally looking at our students and how do we segment our students in order to be able to have that smaller school environment. But at the same time, because we're consolidating and there's a larger number of students there, now we have the ability to generate full-time FTEs for some of those services that our students need. And that we can't do. As you heard Ms. Levy talk earlier, she gets a social worker for like 0.2. That is 0.2 of an FTE, and it takes one to make a full FTE. Is it okay if I ask Dr. Gunlock to supplement anything that I may have missed?
Well, I think there's a couple of things here that I've been listening. And what's interesting is the question that Stephanie, you asked was a question that I was asked today at a town hall meeting, at the Amplify town hall meeting. They brought up, hey, we're in the middle of a pandemic. We probably are doing a lot of at-home learning now. We may do some at-home learning at the beginning of next year. We don't know what that's going to look like. Do we need facilities? And in the short term, there's sort of a short-term, long-term answer. The pandemic is a short-term thing. It's here. It seems like it's forever, but it really, in hindsight, when you're looking at potentially building facilities, they are going to long outstrip when this problem is in the rearview mirror. In fact, if you go back to the last pandemic, the Spanish flu, that hit about the time Merrill was built. And if you really think about that, you got to think in terms of long-range lenses. The other thing is, and Clint referenced this, the decision to do nothing is not a decision. Even if we choose to do nothing, these facilities are still going to incur some pretty significant costs just to keep them going. And so that's important to understand, that we're going to be allocating resources to some facility. The next thing that's really important to think about is the time to finish it. The graph that Clint shared, I think it's Webster L doesn't come online till 2024. Assuming things go as they're planned to go, These buildings will come online years after the pandemic and a vaccine is hopefully in the rearview mirror. So, I think you have to think in terms of this is potentially a 75 to 100-year decision. So we have to kind of place it in that context. So short term, there's going to be a lot of changes that we have to make in order to educate kids in the next 12 months. Beyond that, what we're really doing is we're setting our target for the future. And in that future, we need to compete with districts that are surrounding us that are modernizing their facilities. And we have aging facilities that are going to cost a lot of money to continue to keep going. And I think the Facility Advisory Committee's advice was we should be putting dollars into consolidating fewer facilities that have better features, better services, so that what happens inside the facility is actually matched with what the facility can do to support education.
And I just have one more comment, and then I want to let my other board members speak. But I was just going to say, I would like to see some data on we probably don't have it, but if the community appetite has changed since the pandemic for support of a referendum. So that would be some information I'd be interested in hearing about. And then I'm done. So, thank you.
I see. Excuse me, I see that Clint has his hand up. Sorry.
Yeah, I just wanted to address a couple things. So number one, we'd obviously be going during a presidential election. So certainly no one could say we're trying to sneak anything by the community. Historically, presidential elections have been well supported in terms of if you go back and look at the data. Just a couple other points. Again, we are working with a few other school districts that are very much in the same position as you are. They're actually, a few of them have surveys out right now. So we're going to start to see a little bit if some of the perception has changed. We had a survey that wrapped up kind of middle of May, and actually it was very supportive. People said, yes, go in November. I think you also look at the support that was shown in April. Statewide, the referenda were supported. We certainly did not expect to see that as we were sort of going through it real time. Now, is that perception going to change in November? No one knows that at this point. And then just the last point is again, we have until August 20th to make this decision. Again, the date, you have 75 days before the election. So again, it seems everything changes daily. And so I think we listen, we react, and just know I think we have a path towards November. If we need to push it off for whatever reason, it's not the right time, we certainly can do that.
I'm sorry. Thank you, Clint. I think Dr. Cartwright, you were looking to jump in, and I didn't mean to cut you off, but I had seen Clint's hand go up first.
No, it was actually to ask to recognize Clint.
Thank you. All right. Anyone else looking to weigh in here? Mr. Peschel.
Sure. First, I want to thank you all for the presentation from the beginning to the end. It was chock full of very useful information. I felt like I learned lots of information related from beginning to end. So it was good seeing the mock-ups of the potential elementary school and the middle school, and how that all lays out and brings a little bit more emphasis to the work that we're trying to do. So I appreciate that. I want to kind of echo Steph's kind of emphasis on surveying the community a little more. I think it's important for us to provide the opportunity for our community to still tell us how they feel about this stuff. And so I would encourage us to move forward with some type of survey as well. I do agree with Clint as well in regards to how the overall broader community looks at the success of referendums by using the April outcomes as an outlier as well. So, but I think we just have to still, when doing this, continually ask our community if these directions are still right. Thank you.
Thank you, Mr. Peschel. Is there anyone else who wants to weigh in?
Barb, I have some questions.
All right, Kelly.
And I apologize. I had to switch from my Chromebook to my cell phone. So I was like in the middle of, I think I was up twice. Sorry.
I was confused by that.
I know. So I was trying to like go as long as I could, but I had it up on my cell phone at the same time. So I switched quick. I have a question as far as the money, or what budget does, I know that we want to include playgrounds and things like that for elementary and middle schools, but what about for the elementary or the middle schools? What budget does tracks go on, and what budget does like any field like soccer or particularly tracks, because we do have track as a sport. So is that included in the price, just like playground would be included?
Again, I'll answer. We didn't specifically to this point go through and assign what fields we would look to have there. So the budget right now has some allocation for fields within it as it stands. But we would probably between now and when the district would decide to go to referendum, we would need to finalize kind of what that specifically looks like. There might be some additional, not to get too far ahead of ourselves, but we did discuss some bigger picture things, goals that may not necessitate the need for a track or some of those types of things. So I think there's a larger discussion there.
Okay, I would definitely be interested in those discussions then too, if we're not looking at putting tracks at individual middle schools when we have track as an athletic participation that kids can go into. So I'd be curious about that. You also had said something, you and Phil had discussed about that, talking about having each grade level on a different level of the building. Would the children still be able to, the students go to a different level for math if you're in advanced math? You know, obviously you'd have to go to that teacher, you know, in a different, because you said that each level would have a science floor. So I'm assuming each level would have an art floor, and each level would have a music floor with maybe one larger band room. How does some of that look for the middle school level in particular is what I'm talking about. And Spanish, is there room to grow? Because I know that one of my, you know, foreseeable futures, I would love to grow our language arts and our different languages in the middle school level. So how do we put that in 7th grade, and how do we put, you know, so my questions are, are we putting extra rooms for the future for if we are able to bring Spanish or another language or world language to our younger kids? And the kids if they're in advanced classes, the 6th graders, do they go to the 7th grade wing just like they do now? Would they go to the 7th grade wing to take their advanced math classes? And then you said science and such on each floor. Is art on each floor, or is there one art area? And because we went through those slides so quickly, I wasn't able to kind of like look at them, and I'm sure I can look at them a little bit more. We got them today, and I wasn't able to look at them in depth quite yet. So could you answer those for me quick?
Phil, do you want to answer, or would you like me to?
Yeah, sure. So, you know, we haven't had this specific conversation, I guess, but, you know, any student that would be in an accelerated class, I don't see any reason why they wouldn't be able to access that other grade level.
Right. Okay. Just like we do now.
Yeah. Yeah. I mean, we have, we've had kids at the middle school level that go to North.
Exactly. Yeah.
So I would see it very much like that.
Okay.
Remember, like art and some of those other kind of encore classes are sort of one area of the building.
Yeah.
So
that we would stay that way.
Okay. It would stay that way.
Awesome. Okay.
And I, you know, I, this is probably more of a Clint question, but you know, you know, we did have the future in mind when, you know, designing this, that, you know, we realized that things change, and you know, we might need a room to do something different that we weren't anticipating.
Right.
But I guess I'll turn that over to Clint to discuss.
Okay.
Sure, we have some.
I'm so sorry, Clint. So I guess my
Oh.
question was, with the art and music, when you are doubling a school size, when we're going to go to 850 kids, this is a question that I think I've discussed it, I know, but I know parents have asked me this. So if you have these schools that have 800, 900 kids, they're, you know, quite larger than we have ones now. How do you get enough of them in art and music and some of those extra classes? Do you have 2 or 3 art classrooms? Do you have one? You know what I mean? Like, those are the questions that I'm getting.
Mm-hmm.
So if we can address those a minute, just so, because some parents were asking me, well, are they going to have less art? Are they going to have less music? Because there's only going to be one classroom for double the kids.
Yeah,
those are kind of the questions that I was getting.
Yeah, and our intention is never to take anything away, an opportunity from a student. Yeah. That's not our intent at all. You have to remember that art, like in 6th grade, is something that most all 6th graders take. But after 6th grade, art becomes sort of a choice.
An elective, yeah.
So it's not something they have to do, and that's kind of how middle school is that, you know, same with the music options. Again, after 6th grade, it's an elective, it's a choice for them.
So we would be looking at the numbers that we currently have and what our participation rate is, a percentage of our students, and making those spaces to accommodate that participation rate that we currently do.
Ms. Olmsted, we actually took into consideration the sizes of the rooms themselves.
Okay.
I'm going to ask Clint to jump in on that just a little bit, because the square footage that we've designated for band, orchestra, choir, as well as the art rooms are able to accommodate size. In fact, the size of the rooms which we've designated here are usually about the size of the rooms for schools of this size, if not larger.
God, okay.
Yeah,
so they make the rooms large. I got it. Okay, great. Thank you.
Okay. Can you verify that I'm accurate on that statement, please?
Yeah, that's absolutely correct. And again, we have there. If you can, you might not be able to see it up here, but you actually have 3 art rooms designated. We have several STEM type spaces. Yes, to Dr. Cartwright's point, the band, choir, orchestra spaces are sized appropriately for the building. So yeah, we're very much keeping in mind that those, again, if we'll use the term encore, but those extra classrooms need to support the number of students that we have within the building.
Great, thank you, Clint. Those are just some of the questions that I wanted this group to explain, because those are some of the questions I got from parents, and you guys would have a better answer and explain it better than I could to them. And that's what I thought. I just wanted to double check and make sure that I understood it right, because those are some of the questions I was getting. Thank you.
In fact, Ms. Olmsted, we even put in there, for example, practice rooms and within the music area, which we don't even have the ability to do right now.
Right. Yeah.
And ensuring that they're soundproof, those kind of things, and ensuring that we have an appropriate storage of instruments as well.
Thank you. I think hearing those things and having those will get the citizens and the parents more excited when they think and they hear about those things that we can offer their kids and what these buildings are going to have. I think it just helps us better with the cause. So getting those little details is amazing, because, you know, anybody that's in any of those kind of classes or is interested in those things, that helps move it in the right direction. Thank you.
Thank you, Mrs. Olmsted. Thank you, Mrs. Dr. Cartwright, and thank you, Mr. Sell and Mr. Marshall. Anyone else? Clint, are you raising your hand? Oh, I'm sorry. I'm trying to be attentive here. Mr. Peschel, I see a hand up.
Thank you again. I believe my question is for Michelle. So early on in your presentation, you discussed the Moody ratings for school districts. and you indicated that we were, I think it was like number 13 within Wisconsin, or no, around there, 13 or 14, but that there were 13 above us. So my question is, are you able to share what districts those were that were above us? Do you know, or are they neighbors?
I don't believe any are neighbors. So there are 13 districts that have a higher rating than you.
Okay.
And I, honestly, I'm really struggling to think of who they are right now. But I don't any of are your neighbors.
Okay. That was my main concern, because obviously we're all in the business of educating and strengthening children's lives. But we all kind of compete against each other a little bit to do this. So
yeah, and I think a handful are in the Madison area and a handful in the Milwaukee. So the metropolitan, diversity of tax base help boost them tremendously, so.
That's where I was going to go, Michelle. You're right on. I think they're Dane County, Milwaukee County, Waukesha County generally.
Right.
Sure. And thank you for that response. I guess my next question, I don't know who it's to, but whoever wants to try to respond to it is go for it. I guess my current calculation or last year's calculation based on the slideshows that were provided, we had roughly around 1,000 students between Webster Stanley Middle and total between Webster Stanley Middle and Merrill Middle. But now the number that we're talking about is roughly 800 to 900 students that we're shooting for, maybe 950 within the new facility at Merrill. How do we get to that number? I mean, where's the difference come from? Between 200 to 150 different number of students.
I'll have to take a look at the numbers, Bob. I don't think it was as high as 1,000. If I remember correctly, I think we're maybe the number I'm thinking is I thought it was like 917. But again, keep in mind that if you look at the applied population, it actually does show a decline. So part of the thought was to build these to suit the population that currently exists, knowing that there likely will be a decline. I think it was down to the 850 range. Sure. And then that helps or potentially would help to give you a little bit of flexibility in the future. But I'll have to do a little digging on those numbers. I think what we're building again accommodates what the current middle school numbers are.
Sure. So that was the first slide where we showed the pathway B, breaking down the schools on each side of the city. So just to kind of give you an idea where I saw those numbers, I saw 500 plus at Merrill and then 400 plus at Webster. Those would have been numbers that were current as of last year, not necessarily current as of now. So
yeah, it shows 513 and 404, so that'd give you 917.
Okay, so my math is off a little bit. So
close.
Still, but I mean, you answered you gave me an answer of what I was looking for. Is that we're planning for some level of decline, which in my mind also creates a level of efficiency for those students as well. If we have less students, that means we have staff that can provide a more efficient and greater service to the existing students there as well. And obviously our numbers ebb and flow from year to year as well. So
they do, and if we do indeed continue down the declining path, it's just going to exacerbate the issues we have with Merrill and Webster now in terms of splitting things up and spreading things out.
Sure, because eventually we're going to have a smaller subset of middle school students.
Right.
That if we don't update our schools, we're gonna have that much more fractionization within all of the service delivery.
Correct.
So, I lost my last question, so I'll let someone else talk. Thank you.
Well, while you're thinking of that, Mr. Peschel, it occurs to me that when the district chose the current site for Carl Traeger, they actually had a different site in mind, which was I don't remember the street, but anyway, it wasn't quite as far out as the current Traeger site. But what we've seen is if you build it, they will come. And there was a lot of new housing construction that went on prior to the opening of that building. And we also saw that at Oaklawn, when the new Oaklawn was going up, that open space at the Fair Acres site on Murdoch, which had a big blacktop area, which now is where the Associated Bank sits, and there's a big pond there. But some of you may, and there are apartment buildings there. There used to be a big black parking lot there, and they used to bring a circus to town in that area. And then as the Merrill site, the Oaklawn site started to evolve, so did apartment buildings. And some of you may remember that that was actually the location of the fairgrounds for Oshkosh before it moved to its current location. And there was a large racetrack there. They used to have stock car races and other things going on there. So spaces do evolve. And anytime you build a school, it seems like there will be new housing going in. Now there's limited space on this northeast side for housing. We have the landfill and the prison to the north, and we have the lake to the east. But I suspect we would see some new housing starts, whether that would be apartments or something else.
Barb, quickly, Lakeside also, with the addition of Lakeside, it filled up really fast, and they built up like 90 new apartments over here on the corner of Ripple and Oregon too. So it happened on the south side too.
So I think that suggests that when a community decides to build a new school, there's an appetite by people to have their children go there. And we do know that some of our larger employers in the city will tell us that they try to get new people to live in Oshkosh and send their students to school here, but some of them don't like the curb appeal and they'll go somewhere else. So this might help us to bring people in. Thank you, Dr. Cartwright, for helping me out here.
And I just wanted to add to that point a little bit also, because when things like that happen, your property values also increase. So that is a benefit also to our potential neighbors to these sites as we construct for new facilities. Because historically speaking, usually once you build a new school facility, typically the property values increase.
And you may have a larger tax base to draw from it as a result. Mr. Peschel, did you think of that question that we all are waiting for? Are there any other comments or questions tonight? You've certainly given us all a lot to think about, and you've all obviously put a lot of time, energy, and effort into this, and the folks who were part of your planning teams. It sounds like this should come back to the board at the the second meeting this month, and we have a suggestion to get some data, some information on the appetite for a potential November referendum. Dr. Cartwright.
I apologize. I know Ms. Lodgy is trying to as well. And then also just a reminder, we do have one more section left to this presentation tonight.
I'm sorry, I didn't see Mrs. Szilagyi.
That's okay. I was going to be real quick and just say that I really like how the wings are divided for grade level teams. I think that will help with anyone who has some concerns about the schools becoming larger. I think that was really well designed.
Thank you, Mrs. Szilagyi. Anyone else? All right, I understand we have another section of this. We also have a long consent agenda tonight, and So it is, according to my clock, about 9:30. Does anyone need a break at this point, or do we just want to move forward?
Michelle just has a small presentation to kind of finish up looking at what the financial impact is of the referendum.
And I believe Dr. Gunlock was going to lead into that very quickly, just to set her up for this last piece.
Okay, so but I guess Dr. Herzog, I'm sorry, I didn't mean to interrupt. I didn't know if anybody wanted a break, but this just isn't going to be very long.
Okay, I didn't see any hand raising or anything, or people getting up and leaving, so I think we're good to go forward.
Michelle, if it's possible, we need to transfer over to Dr. Gunlock, please.
Okay, sorry about that.
That's all right. One of the advantages of being me. I can just take it. Okay. Hopefully you all see my screen. I was asked to put together a workshop a little bit on our referendum for learning continuation. And what we want to do a little bit is give you a little bit of a historical perspective. I think it's really important, especially now, for us to take a look backwards to help guide our look forwards. We're going to talk a little bit about the work that the Budget Reconciliation Committee did back in 2014 and more recently in 2016, and how that led to the two different referenda for learning, which was our tagline for the 2014 operational referendum, as well as the 2016 operational referendum. We're going to talk a little bit about the benefits, and then we're going to talk about what next steps are. And I know it's late, so we'll get right into it. I think it's important for everyone, especially those watching on TV, to realize that when revenue limits were imposed in 1993, the Oshkosh Area School District was already a low spending district. So what it in a sense did was cement people in whatever they were doing. So if you were low spending, it locked you in. From 2000 to 2010, boards during that time period actually voted to under levy. In other words, further restrict their own spending 5 of 10 years, which further reduced the spending in relation to surrounding districts. That was very rare because districts were unable to keep pace with their expenses, even with the levy limit authority. Wisconsin did not provide inflationary increases for schools after the unprecedented decrease in financial support around the Act 10 timeframe. So the result was, for the 14-15 school year, we were going to be $2.5 million short, and for the 16-17 school year, $4 million short in our operational budgets. The district's response was to create a strategic plan that was based on community input, and that was strategic plan number 1 and strategic plan number 2. 2 was more advanced, just like 3 is more advanced than 2. In that we spent a lot of time sitting down with community members, asking them really one simple question: what do you want your school district to focus on? In preparation for the 14-15 school year, a budget reconciliation committee was put to work, and the board knew at that time that they had a $2.5 million shortfall. So we needed to do a couple of things. We needed to bring a team of diverse representatives from around the committee to look at all the different budget cut options and then rank order them for us. We gave them detailed data on OASD spending, and we were at that time, you can go back and look at all the different PowerPoints, but we were low spending no matter how you sliced it. We created a series of guiding principles and ground rules, and those rules were based on a few things. In other words, you can't cut things that we're legally obligated to provide. You need to focus on the community-based strategic plan to guide your work. We need to be focused on attracting, retaining, and developing talent, even in the midst of this. What was the impact going to be on enrollment? We were starting to decline enrollment at that point. And more importantly, we were seeing our open enrollment net loss increasing drastically. The other thing in terms of their guiding principle is any of the reductions had to be sustainable. In other words, it couldn't be one-time money. Obviously, health and safety was a concern. So we used a prioritized rubric to create the results. Now, those of you who were around in that 2016 timeframe will recognize this, This was actually the list of the reductions rank ordered by the committee in 2016. What they did is they came up with a target of about 3.4 million for 16-17 and $4 million for 17-18 in reductions. They presented that work to the Board of Education. The reduction list was approved by the board, but the biggest recommendation that the Budget Reconciliation Committee had was don't do any of these. They realized that any of the reductions that were on that list would make us outliers and would make us completely non-competitive. We think we may have an issue now with curb appeal. Imagine curb appeal when the great things happening inside the school are no longer happening inside the school. So their recommendation to the board was this is going to spiral out of control. You should go to referendum and ask the community for their support. So we had two different referenda. In 2014, we had the first, we called it a referendum for learning, where $2.5 million were spent on retaining educational opportunities. In other words, continuing to offer the great programming we were already offering. 1.45 million was to spend on our Learning Without Limits initiative, and that would provide students with access to technology, which in hindsight was awfully wise, given that we would be in a place where we would have had to shut down our schools rather than continue learning with this pandemic. 2016 was the next referendum for learning. Now that one was a little different. The first year we only needed 3.4 million. So the board at that time chose to take the additional $600,000, and that allowed us to put in security cameras. There was a time in the district where we had very few, if any, working security cameras, and that solved that issue. From years 2 through 7, the entire $4 million would be used to retain educational programs. Now, the Learning Without Limits initiative, the 1.45 million is really spent on these core items, putting an infrastructure in place to do what we're doing right now, teacher support via embedded PD through our technology integrators, providing staff with technology and modern classroom technology, which has been paying dividends throughout this process. And then most importantly, in the fourth phase, provide students with access to technology. That's what those referendum funds are used to do. So if you take all of those, what we used to refer to as reductions, and we wanted to sort of turn it on its head and look at what were the benefits that we experienced as a school district over the past 7 years by spending that money. In other words, telling the taxpayers, we really appreciate the resources that you gave us. Here's what we did with those resources. So what we did is we took all of that and we boiled it down into some core areas of support, and we realized that you're going to find that there are 3 core themes. So if we take every one of those, quote, reductions and looked at the positive benefit of not doing them, here were the core areas of support, and they are color-coded for a reason. Number 1, one of the core areas of support was encouraging families to live in Oshkosh by providing students with a personalized, comprehensive, and competitive set of learning opportunities. Second, leverage high-quality staff by continuing to develop their talents and skills, ensuring we remain competitive while focusing expenses on staff growth. Number 3, support classroom instruction and up-to-date resources. Number 4, provide students with a personalized, comprehensive set of learning opportunities to prepare them to lead in the future. Number 5, ensure teachers have adequate time to prepare state-of-the-art lessons and work individually with their kids. Number 6, provide administrative supports necessary to meet increasing student needs as well as community expectations. Number 7, provide the same opportunities to participate in athletics as any other district in our region or the state. Number 8, compensate staff based on market rates in surrounding districts to decrease turnover in our classrooms, because at that time turnover was becoming a very significant issue. Number 9, we provide reasonable class sizes so teachers have the opportunity to individualize education for our increasingly diverse students and their needs. And lastly, number 10, provide a sustainable and modern infrastructure focused on long-term maintenance and ensure we are not deferring costs into the future. In short, don't kick the can down the road. So if you take all of those, you'll see that they really boil down into 3 different support themes. The red ones are ensuring student opportunity. The green ones are about providing quality staff. and the blue ones are providing robust infrastructure. Those 10 comments were repeated over and over when you analyze each of the potential reductions. So if we take those support themes, what's really interesting, if you fast forward to our strategic plan 3.0, you'll see that ensuring student opportunity is a big part of goal number 1. Providing quality staff is a big part of goal number 3, and providing a robust infrastructure and support is a big part of goal 4. Now, granted, they touch all aspects of the strategic plan, but they really do align most deeply with those 3 different goal areas. So those are the positive pieces that we have been using those resources for since 2014-15 school year. And coincidentally, the very things our taxpayers have asked us to do, they are aligned to addressing those issues. So the next steps, in order to continue to prepare our students for their future and those challenges and opportunities that they're going to go through, and make Oshkosh a destination district and a place where people want to locate their businesses and their homes, we have to determine how we're going to replace that $3.95 million in the 2014 referendum for learning, which will sunset at the end of the 2021 school year. And we also need to determine how we're going to replace the $4 million for the 2016 referendum for learning. The good news that I think we'll find out is that by replacing these referenda, because we already levy for them, the tax impact will be negligible. The other thing is that's really important for the board to understand is you have a couple of opportunities coming up to do that. The November 2020 referendum and an April 2021 referendum are 2 election opportunities where you could put a question on the ballot. So that sort of sets the stage for the operational referenda. Everything else we've talked about so far today has been capital. And prior to that, Michelle gave us a really good kind of primer on where we were in terms of our finances. So with that, I would open it up once again for any questions. And then I can kick it back over to Michelle.
Dave, this is Kelly. I have a question quick. So when are those 2 referendums done? The 2014 is done what year?
At the end of the 2020-2021 school year.
Okay, so the end of 21. And what about the 2016?
That's 2 years later, at the end of the 22-23 school year. And just to remind people, that was a question a lot when we were informing people about the referenda. At the time, they're like, well, why 7 years? Why don't we just go permanent? Or why didn't we go 10? Or why didn't we do this? At that time, Springstead did some analysis with us, and 7 years just seemed to be the thing people were interested in. It was an arbitrary decision based upon some community input, and it seems to have worked pretty well. But we knew at that time, 7 years seemed a long ways away. We knew we'd be sitting here having to replace these referenda.
Okay. And so if this may seem like a dumb question, but if we go to referendum and we go this fall in November and it passes, that referendum wouldn't start, that money, because it piggybacks off each other, that wouldn't start until the end of the beginning of 22, and then the other one wouldn't actually start until the 24, right? Like they don't double up.
That is a great question that Michelle's going to answer when she gets to
Okay,
do
great. Thanks.
Yes.
Okay. Thank
But
you.
you're right. I'll just give you a spoiler alert. You're right.
Okay. Okay, good. All right. I just wanted to make sure that I understood it right. Thank you.
Any other questions?
I just have one clarification question. So at the very beginning of this presentation, we saw an outline that there were four parts to a referendum. One was safety and security. Another was district-wide infrastructure updates, and a new elementary school and a new middle school. Is this are the 2 referenda for learning pieces incorporated into the district-wide infrastructure updates, or is that something else?
No. So those 4 pieces that you perfectly articulated are part of the capital referenda. The operational referenda is for the things that we're already spending resources on that we're using to educate kids every day.
Thank you very much. I appreciate that clarification. Does anyone else have a question or comment at this point? we have a lot to digest here, and I think we're going to be talking about this at probably our upcoming regular meetings, and maybe we will need a special meeting or two. We'll see how that flies. Dr. Cartwright, do you have enough direction from the board at this point for a next meeting, or do you need something?
Michelle was going to give you the.
Got one last section on it.
No,
I'm
we're not
sorry.
done yet.
We got to figure it.
This is
Right.
Michelle's very quick piece.
Okay, is this the
promise.
last piece, or are there more pieces?
No, this is the last piece.
Okay, because it seems like we keep unveiling more and more pieces, so, and I don't have an agenda that specifies these, so it's hard to
No,
tell.
it's everything's been noticed in there. We purposely chunked it up because we knew it was going to be a lot of information. And we did not want to overwhelm, we didn't want to overwhelm the board by giving it to you all at one time, and then you weren't able to process it as effectively.
I understand that. It would have been more helpful, as I had shared with you, if the staff report had been a little bit more specific. So moving forward, we'll have that discussion, but I apologize for cutting Michelle off. I thought we were finished.
No, thank you.
Okay.
No problem. I will be brief. So this is just continuing that presentation and getting into the specific referendum projections. And I'm going to start with, I don't know why this, there we go. A little perspective on interest rates, because this was mentioned previously. And so we're just looking at the bond buyer index, which is the index for municipal borrowing rates. And we're looking at the index for 20-year debt, which is what you would be issuing. And we're looking at it, the index over the last 20 years of history. So going back to the year 2000. So this is just piggybacking what's already been said tonight, is that interest rates are at incredibly attractive levels. In fact, they're at historic lows. So this index has reached its low point of 2.16% currently. That might be different than anything you've received prior to tonight. I just updated this chart in this presentation tonight. So certainly an attractive interest rate environment as you look to potentially go to a facilities referendum for 107 million, where you would be borrowing those funds and having, that impact potential taxes. The tax rate impact that we are calculating for 107 million is 85 cents per 1,000 of fair market value. The anticipated year where that impact would occur, if you were to go to referendum in November of 2020 or April of 2021, in either case, I would expect the impact to hit in 21, 22. So that would be tax bills that people get next December of 2021. The levy that this board sets in the fall of 21. I think that's also when you would be renewing the first operating referendum that sunsets, would be the 21-22 year. And then that second one that sunsets would be 2 years after that. However, it's really important to note that both of those operating renewals, let's call it, should be tax neutral. You are replacing a dollar being spent now with with the same dollar to be spent in the future. So we really see those as tax neutral. The 107 million obviously is not. That's new debt service expense that you would be adding, and therefore having a tax impact of, again, projected to be 85 cents per 1,000 of fair market value. There's a number of assumptions that go into that. I'm not going to read those verbatim, but we're assuming the debt is issued in 3 different calendar years, with the first phase of the borrowing being in 2021. In looking at Bray's drawdown, I think that works well. You're going to need funds in 2021 if you go to referendum in November of 20 to start that in those first phases of projects. And certainly there's going to be a lot of design work going on. The second borrowing would be in 2022 and the last one in 23. We've used extremely conservative interest rates here. Interest rates are probably 1% lower than what we're showing here. So more than likely, you know, what we're estimating as a tax impact is conservative, and you would likely come in at even a lower level than what we're projecting. We have your state aid, which offsets it at 13%. And then you can see our projections for equalized valuation growth. And then this is just a visual of, you know, your current debt and what those payments look like. I'm sorry. And how this new debt would just, you know, be stacked on top of it. So we have the levy here on this axis and the tax rate represented by the line. So that's just a, you know, picture of what the debt service and the tax impact would look like. Any questions on that?
I do have a question. When do we retire the debt on Oakland? Was that a 20 year or a 30 year?
It was a 20 year. So I want to say it's going to be
about 2033.
It would just take me a minute to look at.
Yeah, I'm afraid to flip off of the screen.
I think it opened in
probably 32 or 33.
I'm sorry. 20.
It's done in 2032.
Okay, thank you.
So the other debt represented here is obviously the energy efficiency debt that's
I apologize for cutting you off, Michelle. I'm glad you were able to provide us with this detail.
No problem. No problem.
Is there anyone who has a question or a comment at this stage? All right, Dr. Cartwright, do you have what you need from the board tonight, or is there something else you need for the next future meeting on this topic?
No, I know that we have some questions that we'll be able to prepare to be able to present at the next board meeting. We'll also ensure that some of the more key points that were presented tonight, that we put it into a more slimmed down, precise presentation for you. Just a review again, only because we want to ensure that we're keeping everybody on the same page.
Will the, I do have a question, will the PowerPoints that we saw tonight be on the district website for future use by the board?
Yes, they're already posted underneath the Facility Advisory Committee. The only one we're waiting on is I'll need a copy of Michelle's to post it.
Okay. Well, again, I want to thank everybody who contributed to tonight's workshops, particularly these last two. You've given us a lot to think about, and I'm sure that in the next 2 weeks before the next board meeting, some board members will be receiving phone calls, emails, whatever, and can pass those along to Dr. Cartwright so that we can be on top of those and can address everything in a timely manner.
Absolutely.
All right. Well, thank you for our guests tonight who have been with us since 6 o'clock. Appreciate that. All right, may we move on then to the consent resolution agenda? All right. For the consent agenda. I'm sorry. Did I?
It's an echo on.
You're kind of cutting in and out. I'm missing something here.
It was just an echo on your line. You're good.
Oh, thank you. Okay. For the consent agenda, the board has been furnished with background material on each item or has discussed it at a previous meeting. These will be acted upon with one vote without discussion. If a board member wants to discuss any item, it will be pulled out of the consent agenda and will be voted on separately. I have heard that someone wishes to, well, I plan to pull 1B retirements and also board and superintendent letter, which is number 3. Does anyone else want to pull one of these agenda items? Mr. Peschel.
Sure. I would like to pull resolution 1A, please.
All right. Anyone else? Mrs. Olmsted.
I'd like to pull number 2.
All of number 2?
Yep.
Okay. So does that mean that we are
separately?
So does that mean
I'm pulling number 2 and hoping that when we discuss it, that a board member will make a motion to waive that reading.
Oh. Okay, I thought you were pulling that so we could vote on each one of those individually.
No.
Okay. Do that. All right. All right, so right now we only have 1C on for a consent resolution agenda. Is that correct? All right. Let me get my right paperwork here. I wasn't anticipating this. All right, be it resolved that the Oshkosh Area School District Board of Education approve the resignation as filed with the Secretary to the Board of Education in accordance with the rules, regulations, and policies of the Board of Education.
So moved. Evans.
Second, Olmsted.
Please call the roll.
Peschel.
Aye.
Peschel, aye. Szilagyi.
Aye.
Szilagyi, aye. Carlin.
Aye.
Carlin, aye. Evans.
Aye.
Evans, aye. Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Olmsted.
Aye.
Olmsted, aye. Motion carried.
Thank you very much. Now we will go to resolution 1A. Be it resolved that the Oshkosh Area School District Board of Education approve the appointments, temporary appointments, resignations, and salaries as filed with the Secretary to the Board of Education.
So moved, Olmsted.
Second.
Peschel.
Teresa can make the call on that one. I don't know who she. Okay, it's been moved and seconded. This gives us an opportunity to open this for discussion. Mr. Peschel.
Sure. So the reason why I've asked for this one to be pulled out of the consent agenda is that my wife is listed on this in this resolution, Jenna Larson. She's the new art teacher at Jefferson School, along with some time with the WIT program. So, so there's an obvious great conflict that I have here because I believe that the Oshkosh Area School District is adding an exemplary to the art department. I am, and the bias is good because she has a long history of already substituting, volunteer the Oshkosh Area School District. She has been an artist in residence at Washington School, where she created a huge glass mural. Her attributions to the district will be great and will be wonderful, and our kids will love her. So, so with that, I need to vote present, but I'd like you guys to entertain a motion to divide 1A into 2 parts. So one part would be everyone except for Jenna, and then the other would be another part that is just Jenna, because that way I can then vote yes on all of the other teachers and staff, but then specifically vote present as it relates to Jenna's employment in the district.
I believe we would need an amendment then to the resolution. Teresa, can you help with that?
You can make a motion to divide and it needs a second. There can be no debate and then it's a majority vote. But it is an amendment per se. You're dividing the question into two pieces.
Okay.
So I would make a motion to amend the resolution to so that there are two. One would be everyone except for Jenna, and then there would be another one that is just Jenna.
Mm-hmm. So you're asking to divide the question?
Yes.
I'll second that.
All right, and I believe that Mrs. Collins advised then that we just need to go ahead and vote without discussion on dividing the question. Is that correct?
That is correct. Let me
Okay.
just make sure I'm giving you the right information here. Yes, no debate, and it would take a majority vote
All right, then please call the roll, Mrs. Collins,
to divide the question.
to divide the question.
Salaji?
Aye.
Salaji, aye. Carlin?
Aye.
Carlin, aye. Evans?
Aye.
Evans, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Olmsted?
Aye.
Olmsted, aye. Peschel?
Aye.
Peschel, aye. Motion carried to divide the question.
Divide the question. Okay. Now, do we need a motion on how this is to be divided?
No, because that was part of the amendment. I believe Mr. Peschel explained that, so that's part of that amendment. So when we vote on 1A as amended, it will be everyone but Jenna Larson.
Okay.
And then we'll vote on a one, I don't know how you want to number it, 1A, the second part of 1A with just her on there.
1A1, 1A2,
Sure.
I don't know,
Mhm. That's fine.
whatever you advise. All
Sorry to
right,
make it so complicated.
Nice, Bob.
and is this also without debate?
No, now you're talking about the amended resolution and you can discuss that.
Okay, so this would be resolution number 1A1, which would be all except the temporary appointment of Jenna Larson. Do we need a motion?
We have a motion and a second
All right,
already.
good enough.
Mhm.
Thank you. Any further discussion? Seeing no interest, let's call the roll, please.
Carlin?
Aye.
Carlin, aye. Evans?
Aye.
Evans, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Olmsted?
Aye.
Olmsted, aye. Peschel?
Aye.
Peschel, aye. Salaji?
Aye.
Salaji, aye. Motion carried.
All right, so this would be resolution 1A2.
Mhm.
And this would just be for the appointment of Jenna Larson as a full-time art teacher under a temporary appointment for the 2020-2021 school year. Any discussion? Seeing no interest, please call the roll.
Evans?
Aye.
Evans, aye. Garner?
Aye.
Garner, aye. Herzog?
Aye.
Herzog, aye. Olmsted?
Aye.
Olmsted, aye. Peschel?
Present.
Peschel, present. Salaji?
Aye.
Salaji, aye. Carlin?
Aye.
Carlin, aye. Motion carried.
All right, thank you very much. Now on to resolution number 2.
I would like to make a motion that we waive the reading of all of the points under
Point
2.
of order. I think
Point of order.
we'll vote on 1B first.
Yeah.
I'm sorry.
1B.
Oh, I'm sorry. Sorry about that. Resolution 1B. Thank you for helping me here. Be it resolved that the Oshkosh Area School District Board of Education approve the retirements as filed with the Secretary to the Board of Education.
So moved. Evans?
Second, Peschel.
Thank you. I had asked that this be pulled. We are losing two more individuals who are deciding to go into a new age and stage of life called retirement. Dorothy Durant has served as a health assistant in the district as an LPN since 1987. So she's retiring with approximately 33 years of service to the district. And Nancy Schumacher is retiring from Reed Elementary School as an ESOL teacher. And she's been with the district since the year 2000. So in other words, 20 years. I'd like to thank these two individuals on behalf of the district for their time and effort that they've put into making the education of our students a priority and for encouraging student learning and growth during their time in the district. Any other comments? Please call the roll.
Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Olmsted.
Aye.
Olmsted, aye. Peschel.
Aye.
Peschel, aye. Salaji.
Aye.
Salaji, aye. Carlin.
Aye.
Carlin, aye. Evans.
Aye.
Evans, aye. Motion carried.
Thank you very much. Now we can go on to resolution 2. Be it resolved that the Oshkosh Area School District approve the Neola policy updates as filed with the Secretary to the Board of Education.
I make a motion to waive the reading of all the policies.
Second.
Okay. Do we need anything further on that, Mrs. Collins?
Just the roll.
Wonderful. Is there any discussion allowed?
It's an amendment, so you can discuss it if you'd like.
Wish to discuss it? Please call the roll.
Herzog.
Aye.
Herzog, aye. Olmsted.
Aye.
Olmsted, aye. Peschel.
Aye.
Peschel, aye. Salaji.
Aye.
Salaji, aye. Carlin.
Aye.
Carlin, aye. Evans.
Aye.
Evans, aye. Garner.
Aye.
Garner, aye. Motion to waive the reading carries.
Thank you. Resolution number 3, be it resolved that the Oshkosh Area School District approve
Point of
the,
order.
I'm sorry.
You still have to vote on number 2. We just voted to waive the
I'm
reading.
sorry.
That's okay.
I am just not with it tonight. I guess I'm not feeling well or something.
No, I'm sorry, Dr. Herzog. I know it's been a very long meeting. And candidly, we've heard you in the past make the comment that too bad someone couldn't waive the reading. So we were just trying to accommodate that for you tonight.
Thank you. I appreciate that. I'm just feeling exhausted, to be honest with you. So it doesn't, anyway, I won't make excuses. All right. So we voted on the amendment to waive the reading. So now we need to vote on the actual resolution.
Yes.
Thank you. Thank you all for keeping me in line here. Please call the roll.
Olmsted.
Aye.
Olmsted, aye. Peschel.
Aye.
Peschel, aye. Salaji.
Aye.
Salaji, aye. Carlin.
Aye.
Carlin, aye. Evans.
Aye.
Evans, aye. Garner.
Aye.
Garner, aye. Herzog.
Aye.
Herzog, aye. Motion carried.
Thank you. Now I think I can go on to number 3 since it's the only one left. I'll try not to mess this up. Be it resolved that the Oshkosh Area School District Board of Education approve the board and superintendent letter to legislators as filed with the Secretary to the Board of Education.
So moved.
So
Evans.
moved. Second, Olmsted.
Thank you. I had asked that this be pulled so that Dr. Cartwright or someone could explain what this is. And then I also had a couple of suggestions for edits. I don't know if anyone else has anything they want to share. So in the interest of being open and transparent, I thought we should have the chance to share what this is with the public.
No problem. So Dr. Herzog, I can present that for everybody. The purpose of the letter is to inform our local legislators about the challenges that the Oshkosh Area School District faced during the COVID-19 pandemic event and how the district addressed those challenges. Specific attention in the letter includes information about the size of the school district, because oftentimes people do not recognize that we are the 11th largest district in the state out of over 400 districts. It also talked about our process used for transitioning to our learning at home. It gives information related to the use of our Chromebooks and our Wi-Fi hotspots. It describes methods that staff use to keep students engaged and to support our students, families, parents, and caregivers. It also provided information about the level and type of communication provided, and that's from staff members as well as from district office as well as from our school administrators. It gave information about how the district served the needs of our students, both not only academically but also socially as well as with mental health needs. Provided information about our grab and go program, and the expression of our commitment to having our continuing with that student first approach as future plans are being made now, and an expression of gratitude for their ongoing support. So those are the high points that are included within this letter that has been drafted in conjunction from the Oshkosh Area School District Board of Education as well as myself.
Thank you, Dr. Cartwright, and I really appreciate the fact that you put this draft together in a short time frame. And Mr. Evans referenced it during his legislative committee report earlier, noting that we would likely be the 15th district in the state to send letters to lawmakers and the public to inform them as to how we have handled the last 12 weeks of the school year with the challenges that have been unprecedented that we have faced. Does anyone else have anything they want to share on this letter?
A question. I just want to make sure that the signatures that are included on the letter, if that is how everybody wanted to be represented, or if others wanted. So, for example, Ms. Laji, I put the name that you typically go by Liz. I wasn't sure if you wanted your full first name. Mr. Evans, I put your first name as Jim. I wasn't sure if you wanted your formal first name on the letter. So I'm looking for feedback on that as well, please.
No, everything I sign is Jim, so that's good with me.
Mm-hmm. Me too.
I got to be the difficult one. I actually sign everything Robert. So if we put my signature on it, it would read, though you wouldn't be able to read my signature. I'm not sure it matters because people understand that I'm Bob Peschel no matter what, whether I go by Robert or sign Robert. So
I will make an appropriate adjustment.
Okay.
Okay, do you have what you need, Dr. Cartwright, on the signature question?
I do, and I also noticed that we have a typo on Ms. Olmstead's name, so we'll make sure we get that corrected as well. And there was a concern related to the second paragraph that it was written in past tense. There's one sentence in there. I just need to ensure that we continue to write in past tense. It's about 3/4 way down on the right-hand side where it says families were also invited back into the school on Monday and Tuesday to retrieve whatever materials. And it said they may need, we're going to revise that to whatever materials they needed to learn in an online environment. So we'll make that into past tense.
Thank you. I had the same question about 4 lines above that. The line that begins while staff members met and received support that they, I think needed would be the appropriate verb there as well. And it would parallel what you just edited then.
Okay, we'll make that revision.
If the rest of the board is okay with that. Anyone else? I don't see any other activity for input, so please call the roll, Mrs. Collins.
Peschel,
Aye.
Peschel, aye. Salaji,
Aye.
Salaji, aye. Carlin,
Aye.
Carlin, aye. Evans,
Aye.
Evans, aye. Garner,
Aye.
Garner, aye. Herzog,
Aye.
Herzog, aye. Olmsted, Olmsted,
Sorry, aye.
Olmsted, aye. Motion carried.
Thank you very much. Do we have any announcements for tonight?
I have one announcement.
All right.
Sure. So most of you probably know this already, based on the news that was passed last night at the city council meeting, that the Oshkosh Common Council passed a diversity, equity, and inclusion committee last night. And so why I bring it up tonight is that there is conversation about potentially adding a UW Oshkosh and an Oshkosh area school district liaison to the committee. It wasn't part of the approved referendum from last night, but this may come up at our next meeting as to add it to the makeup of the committee. And so it's just out there for conversation. I know Dr. Herzog, I think you've had some conversations about this, but right now it's kind of undefined as to who that liaison would be to represent the district, but that it's out there in conversation. And so I felt that it's an important enough issue in our community right now that I'm supportive of adding such a liaison with that. But I think it's important that if you didn't chime into the conversation last night or watch the meeting, that our involvement in the discussion around diversity, equity, and inclusion, we were looked at as potential partners within that conversation. So,
Hey, Bob. Oh, never mind. It's announcements. Never
I'm
mind.
all
I
done.
can't talk. No, I don't think we can talk about it. Never mind.
Okay.
Thank you, Mr. Peschel, for sharing that. It's a very important topic. And as Dr. Cartwright included in her comments tonight, we are moving in that direction of attending more to diversity and equity in our own district. But it's a larger question. All right, any other announcements? All right, then I would entertain a motion to adjourn to executive session for the purpose of 1, deliberating or negotiating the purchasing of public properties, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session under Wisconsin statute 19.85, parend 1, parend E, a purchase of property.
So moved, Olmsted.
Second.
Please call the roll.
Salaji,
Aye.
Salaji, aye. Carlin,
Aye.
Carlin, aye. Evans,
Aye.
Evans, aye. Garner,
Aye.
Garner, aye. Herzog,
Aye.
Herzog, aye. Olmsted,
Aye.
Olmsted, aye. Peschel,
Aye.